organizing Tadvidya Parishat 2026 International Intellectual Conference of Ayurveda. To this mega event, I welcome today's panel judges, esteemed Sorry for the interruption. I welcome today's panel judges, Dr.Srivatsa Navalur, Professor and Head, Dept of Panchakarma at Sanjeevi Ayurveda Medical College and Research Center, Hubli. Welcome you, sir. Dr. G. Kannoli, Associate Professor, Department of Samhita Siddanta, SVM Ayurveda Medical College, ilkal. Welcome you, Dr. Aravind. And we have Dr. Sharad Kumar Prajapati, Associate Professor, Department of Samhita Siddhanta, Ayurveda Institute, which is very new, emerging, a very new institution in the field of Ayurveda at Karnataka from Hubli. Welcome all three panel judges to this event. It is the first round of scientific paper presentation, batch 2 of 2026 conference. Once again, I welcome all the judges. Same way, I also take an opportunity to welcome the presenters for today's slot. We have 17 presenters today, and I wish them good luck and make a time to irritate judges, scratch their head with your vocabulary, with your scholarly thought and presentation skill to score you whom to be scored well or whom to be given the first prize or second prize and so on. Make judges in a difficult position to judge your presentation. With this, I wish you all a good luck. I also welcome my organizing team, scientific committee members, and media experts who are streaming it live. I also welcome the viewers through YouTube, where the session is broadcasting live throughout the presentation. Thank you one and all for joining in time. I hand over to the event managers, Dr. Jeevita and Dr. Harshita, to lead the event. Thank you.
Thank you, sir. Shveta Padmasane Devi Shveta Gandhanulepana Archita Manubhis Sarva Rushibhistuyate Sada Evam Dhyatva Sada Devim Vanchitam Labhate Naraha Harihi Om Shri Gurubhyo Namaha. Invoking the divine blessings of Ma Saraswati and Lord Dhanvantari, on behalf of Tadvidya Samhasha Parishat, I cordially welcome you all to the second day of online paper presentation. Tadvidya Samhasha Parishat, over the years, established itself as a distinguished academic forum, consistently fostering an environment that unites scholars, students, practitioners, and Ayurveda enthusiasts for meaningful intellectual exchange and scholarly deliberation.
The theme for this year, Patha to practice, Patha Avabodha Anusthana, signifies a vital and transformative journey from in-depth comprehension of Ayurveda to precise, ethical, and effective application in clinical practice. To guide and evaluate our session, we are honored to have an established, esteemed panel of judges, and it's my pleasure welcoming Dr. Srivatsa Sir, Professor and HOD, Department of Panchakarma, Sanjeevi Ayurveda Medical College, Hubli. We heartily welcome you, sir. And we have Dr. Aravind Kannoli, sir, Associate Professor, Department of Ayurveda Samhita Siddanta, SVM Ayurveda Medical College, ilkal. We heartily welcome you, sir. And we have Dr. Sharad Kumar, sir, Associate Professor, Department of Samhita Siddanta, Rashmi Institute of Ayurveda Kudligi. We heartily welcome you, sir. And a special welcome to Dr. Saurabh Kokatnoor, sir, Managing Trustee of the Tadvidya Sambhasha Parishat Trust. Now, without any further to ensure that we stay on a set schedule, here are the guidelines for our presenters. For presentation, you will be given 5 minutes, and this will be followed by 2 minutes for question and answers with judges. And please stay background. And I request whoever is presenting, please keep your video on while throughout the presentation. And the first participant is Dr. Sri Chandana.
Yes, ma'am.
Harshita, your voice is not clearly audible. Please repeat the rules once again.
Okay, sir. Every presenter will be given 5 minutes to present your paper. And this will be followed by 2 minutes of question and answers with the judges. And I request the participants to please stay muted unless it is your turn to speak to avoid background noises. And I request whoever is presenting to keep your video on throughout the presentation. So our first participant is Dr. Sri Chandana.
Yes, ma'am.
Please keep your video on, doctor.
I'm not a doctor. I'm still a student, ma'am.
Okay. Are you ready?
Yes, ma'am.
Okay, your time starts now.
A very pleasant evening to all. Myself, Sri Chandana, and I am a second professional BAMS student. The title of my presentation is Conceptual Exploration of Grahani Roga in Ayurvedic Literature. Next slide. These are the contents of my presentation. Next slide. So before jumping into my topic, let us know about what is grahani. Grahani is an abode of Agni. Its main function is annasya grahanat, and it actually functions as it receives the undigested food and releases the digested food from its left side to pakvashaya. If the Agni becomes durbala, it releases pakva apakva ahara downwards, and this condition is called as grahani gada. Next slide. So let us know about Nidana of Grahani Roga. Yohi bhukte vidim tyakatva grahani doshajan gadhan sa laulya labate shigram. That means if the person consumes food without following ahara vidhi due to laulya, that is greed, this will lead to Grahani Roga. According to Sushruta, if a person has mandagni and even after subsidence of an attack of atisara, he still indulges in atyasana, unwholesome food and excessive food, this will lead to Grahani Roga. Next slide. This is the Samprapti. Now let us know about the Samprapti of the Grahani Roga. Now let us take an example. If a person has Manda Agni and he still indulges in very Guru and Snigdha Ahara and very unwholesome food, and he still continues to do for long time, that is Nidana Sevana, this will lead to aggravation of Vatadi doshas, leading to disturbance of Agni and Grahani. And if he still continues the same, this will lead to development of Ama and leads to localization of Vatadi doshas and Rasadi dhatus in the Annavaha Srotas. Then again, if he continues this for longer time, this will lead to incomplete digestion of food, which goes either upwards or downwards. Whenever it goes downwards in the form of pakva apakva condition, this will lead to grahani gada. Next. This is how the Samprapti Ghataka of the Grahani Roga looks. The dosha is Pradanyata is Pitta Pradana Tridoshaja. Its Dusha is Rasa. Agni is Jataragni Mandya. Its Sanchara Sthana is Mahasrotas. Uddhav Sthana is Ama Pakvasha. Vyakta and Adhisthana is Grahani. And its Srotas that is affected is Rasa, Annavaha and Purishava Srotas. Next slide. Now let us know about what the patient actually in the initial stage will feel, that is early symptoms, that is Purva Rupa, that is Trushna, Kaya Gaurava, Alasya, Chirapaka means it will take longer time for the digestion of the food, Vidaha, Balakshaya. Next. Now let us know about the Samanya Lakshana of the Grahani Roga. First, the patient expels the feces in Atisrishtam, means excessive quantity, Bibaddam Vadrava. It may be solid or at times even it may be liquid. It is associated with Trishna, Aruchaka, Asya Vairasya means distaste in mouth, Preseka, Tamaka, Shunapada Kara means swelling of the hands and legs, Asti Parvaruk,
chardi, jwara, daha, and loha duma gandhika means the breath of the patient will be of the smell of loha, that is iron and smoke, and ama, and pitta mala udgara, that is sore eructation. Next, these are the Samana Lakshana of the patient. Now, Charaka and Sushruta have divided the Grahani Roga into 4 types, that is Vataja, Pittaja, Kafaja, and Sannipataja or Tridoshaja. This is based on the Nidhana Sevana and symptoms which is shown by the patient. For example, if the patient is consuming very Amla and Pitta Hara and very Ruksha Shita Hara, this will, and he will show the symptoms like Ama Parshva Shula and Rukshat of the whole body. This is Vataja Grahani Roga, and this same goes for Pittaja Kafaja. In Sannipataja or Tridoshaja, all the symptoms of all the 3 doshas will be shown. Next. Now let us move on to the chikitsa, that is treatment procedures. First, if the doshas resides in the still grahani and grahani is affected by the indigested food, the patient will be administered with vamana of madana phala decoction with pipali and sarshapa. And if the ama is not in grahani, ama is moves to Pakvashaya, the patient will be administered with Virechana with Deepaniya drugs. And if the rasa dhatu of the patient, moves all around the body with mixed of ama, the patient will be administered with Langana and Pachana. Then after this, after the ama digested fully, the patient will be administered with Snehapana for 2 to 3 days and Sweda and Niroha Basti. And after all the treatment procedures and Shodhana procedures, if the patient feels constipated and if the patient feels raukshatva, the patient will be given Anuvasana Basti. The Basti also plays a crucial role in treatment procedure. Then I have taken Takro Prayoga because this is very ideal for the treatment of the Takra Prayoga is very ideal for the treatment of the Grahani Roga. Then after this, manasa of the patient, he should not indulge in the same type of ahara vihara. After this, he should be able to control his urges, and maintaining patya will be able to cure the patient. Thank you.
Okay. So the time taken is 5 minutes and 23 seconds. Now the panel is open for discussion.
Chandana, can you exactly tell the nirukti of the word grahani?
Sir, shloka I should tell.
Yes, like
Sir, annasya grahanat, that which do the function of the means receiving the anna, that is grahani.
please cross-check once with Amarakosha or any other such dictionaries like Vachaspatya or anything. So it will help you for better understanding. Okay.
Okay, sir.
Okay. Thank you.
Thank you, sir.
Nice presentation, sir. There is no any comment. We'll move for the next one, ma'am.
Okay. Thank you, sir. Thank you, judges.
Our next presenter is Dr. Mamata Shri.
Wait, Arshita, wait. Let other judges, if they have any comments, they can.
From my side, nothing is there.
Okay.
So from my side also, no questions, sir.
Srivatsa, sir? Srivatsa, sir, we are unable to hear you.
Sir, no questions from Srivatsa sir.
Okay, fine. Go ahead.
Thank you, sir.
Okay, we have our next participant, Dr. Mamata Shri.
Yes, ma'am.
Please keep your video on, ma'am. You're ready?
Okay, ma'am.
Okay, and your time starts now.
Namaste, judges. Myself, Dr. Mamata Shri from Kalavareshwar Ayurvedic Medical College. I'm a PTSR second year PG scholar. My topic is on Ayurvedic management of Saprajavandhyatva with respect to secondary infertility case report. Means the introduction and infertility is defined as the inability to conceive after 1 year of regular unprotected intercourse. It is broadly classified as primary and secondary. According to Charaka Samhita, Charaka classified Vandhyatva as Sapraja and Apraja Vandhyatva. Secondary infertility is taken as Sapraja Vandhyatva. Infertility etiological factors are many are there. Along with that, the main means maximum the etiological factors in that one of the factors are cervical pathology, tubal damage and endometriosis and salpingitis, tubal fibrosis and blockage. And in that chronic cervical ectropion means chronic chronic PID, which leads to the cervical and erosion, is the one of the factor for the infertility. So in this study, we are mainly we are only treating that condition. The purpose of the study is role of the unique Shara Karma in Karnini Yoni Vapat with respect to cervical erosion and Yoni Pichu Karma in Paripluta Yoni Vapat with respect to pelvic inflammatory diseases, and role of these Tanika Chikistas, how it helps further restoring normal reproductive function and facilitating natural conception, and understanding the Ayurvedic principles involved in managing Sapraja Vandhyatva. Next slide. Methods. In this case study, the female patient of 28 years who is a housewife, and we are taken all the history, and here we administered some medicines. Next slide. Case report. And she's main complaint is anxious to conceive since 9 years, and our associated complaints are scanty menstruation since 1 year and white discharge. And also the Rajo Vrittanta is scanty since 1 year, and Prasava Vrittanta is P2L2 A1 D0. That she's multigravida, and she's having 2 babies. Last two are FT&D, normal delivery, and second baby is 5 years. And we done a general examination, all is normal, and we done local examination. Because she having complaints of white discharge. So, and that is severe white discharge, she told. Through pulse speculum examination, we got to know that there is a lower lip of the cervix is eroded and bright red inflamed cervix was seen along with white discharge, which confirmed that as a cervical erosion. She is not having tendency of bleed. Next slide. The slide is not visible. This is a Samprapti. Next slide. It is not visible only. A treatment, the first line of treatment, the first 7 days, because of she's complaining of scanty menstruation, we thought to give first line of treatment as Sarvanga Udvartana. She having complaints of white discharge, so we thought, we planned to give the 7 days of Yoni Kshara Karma and Yoni Pichu, and along with next slide, Yoni Pichu Karma, and along with that internal medication Gandharva Astadi Taila 20 ml with milk before food morning for 5 days. Yoni Pichu with Balagudichadi Taila, Yoni Kshara with Apamarga Kshara, and Sarvanga Udvartana Trifala Chuna for 7 days. Observation we got is reduced pervaginal white discharge, the healing of the cervical erosion, lightness of the body, and improved appetite. After 7 days, we done pulse speculum examination. The cervix is healthy, minimal white discharge. After 7 days of treatment, actually we thought to next procedure, but the patient is not willing for the complete whole Shodhana procedure. We gave first, after 7 days, we gave Falagruta, 1 tablespoon BD before food for 1 month. In the subsequent month, next month, she got the patient conceived naturally only. Next slide. Here, mainly the Sthanika procedure we done is Yoni Prakshalana with Purva Karma is Yoni Prakshalana with Trifala Kashaya, Yoni Glata Kleda Shodhana, and Pradhana Karma is Pratisarana Papamarga Kshara. And we leave for 100 Matrakala in each sitting, followed by Kshara Kshalana with Nimbus Varasa, and Pashat Karma is Balagurchetala Yoni Pichu. These are the reports, and this is the before treatment, after treatment, cervical means cervix pics. Next slide. And
Your time is
discussion. This
So the time taken is 5 minutes 8 seconds. Now the panel is open for discussion.
Mamta, can you explain more about Yonik Shara Karma?
Yes, sir. Unique Shara Karma means Charaka Samhita, 13th chapter, the Univyapa Chikitsa Adhyaya, it is explained as one of the Sthanika procedure. Kshara we are using is Apamarga Kshara. Mruda Apamarga Kshara we are here using, and Yavak Kshara also we can use. First we have to through perspiculum examination, Cascas speculum, we have to visualize the cervix, and we have to, though in sterile condition, we have to apply the Kshara, means Apamarga, or means according to condition. The Kshara is mainly helpful for the Shodhana of that area, and it will, means the columnar cells which are came from inside, means cervical. The cervical cells which are changed, that Kshara will heal that cells. The Shodhana, it will takes place, Lekana Shodhana, the cells will takes place, and by that the healing process of the external loss of the cervix will takes place. After Shodhana, Kshara will help for the healing of the eroded cells of the cervix. And afterwards, it will help for the reducing of the infections. And by that, the cervical mucus, it is helpful for the sperm motility and sperm entry to the uterus. So it will helpful for the infertility treatment patients.
So is she conceived now after the treatment?
Yes, sir. Next cycle, she conceived.
Okay. Thank you. No questions from my side.
A nice case presentation, doctor. Can you make a link between the Yonik Shara Karma, Yoni Pichu, and Gandharvasa Taila?
Yes, sir. Actually, along with Udvartana, we gave Gandharva Astadi Taila as Mrudu Shodhana. All patients will not agree for the means that's normal Shodhana, what we are giving Udvartana, Vamana, Virechana, like that. This is the patient is very poor, means he can't able to come every day for the classical Shodhana. So we thought to give the Nitya Virechana. This Gandharva Astadi Taila helpful for the means Mrudu Vata Anulomana, Mrudu Shodhana as Vata Anulomana. Here is Apana Vata Vaigunya. So the Gandharva Astadi Taila helpful in that way. In Yonik Shara, Yoni Pichu, it is mainly for the that cervical erosion and PID. Means she's having chronic PID. After chronic PID, she got the cervical erosion because her complaint is pervaginal white discharge since 1 month. So we focused on the Sthanika procedure for the after Sthanika.
Okay, doctor. There is a taila is in a Shukrahara. When you given a pichu, that with the Balaguduchi tailena. how
Yes.
it will make in a conceive?
What, sir? What? Once.
Balaguduchi Taila Pichuvar did, na madam?
Yes, sir. Yeah.
But Taila Yoni Vishodhanakara. But simultaneously it does than Shukrahara.
No, sir, it
What
is
your
not.
interpretation?
Balagudichi Taila, it is mainly Vatahara, and Balagudichi Taila is mainly Vatahara, Brahmana action, and it will helpful for that Snigdha type. Means after Yonic Shara, the area is
It will
more
reduce the
like
Kshara effect.
not that means after means 100 matra kala we are leaving the Kshara at that place only. After 100 matra kala we will apply Nimbus Varasa for neutralization. After the for maintaining the means that integrity of the that one Balagudicharitala helpful for the Vatahara and that dryness for dryness purpose. And also,
Nice.
it is proven means it is proven in PID conditions. It is very helpful for lowering the infection rate by improving the self.
That's good, madam. It's and there is article is there. Yeah. Okay. Thank you.
Thank you so much.
Hello, is this audible?
Yes, sir. It's audible.
Okay. How come this Kshara, whether it brings inflammation?
What, sir?
Kshara, whether it brings inflammation?
No, sir. It will not bring inflammation.
Sure.
Yes, sir. Sure. Means the will squamous cells damage means after damaging the squamous cell, columnar cell will come. The applying of the Kshara, it will erode means it will heal that columnar cell means that after that the normal squamous cell will grow. It will not increase the inflammation. It will decrease, sir.
Okay, thank you.
Thank you, sir.
Thank you all the judges and thank you Tadvidya Sambhasha Parishat for the opportunity. Thank you so much.
Thank you. Our next participant is Miss Faziha Maheen. Miss Faziha Maheen. Miss Faziha Maheen. Are you ready? You're not audible. You're not audible to me. Miss Faziha Maheen, you're not audible. Please check for your connection. Until then, we'll go to the next participant.
Fasiha Maheen, you can log out and log in again. There is some connectivity issue with your mic and audibility. Till then, take up for the next presenter.
Yes, sir. Next presenter is Dr. Neeraja Pitre. Dr. Neeraja.
Yes, ma'am.
Please keep your video on. Are you ready, ma'am?
Yes.
Okay. Your time starts now.
Very good evening to all. Myself, Dr. Neeraja, final year PG scholar from Department of Panchakarma from STM College of Ayurveda Udupi, presenting the topic entitled The Clinical Approach in the Management of the Diabetic Carbuncle with special reference to Prameha Pidaka. Next slide. Next slide. The Prameha Pidaka are a common yet a severe complication of the Prameha. Acharya Sushrita in the Chikitsa Sthana says, Pidika Chikitsite api Prameha Chikitsita Muktam Athava Prameha Chikitsite Naiva Pidikopashamo Bhavatiti, which means the Prameha Pidaka can be treated only when we treat the Prameha at the first place. The diabetic carbuncle is an infective pus-filled blister that occurs in the immunocompromised diabetic patients, and if it is left untreated, it may lead to necrosis, sepsis, and even the death. Next slide. So coming to the case study, the subject of age 51 years old male was a known case of Parkinsonism, hypertension, and diabetes mellitus since 20 years. Then he was under allopathy medication for the same, and he developed a blister with a multiple pus pockets at the right lower limb. So the incision and drainage has been performed at a local hospital, yet the wound refused to heal. So the patient approached us with the wound which was having the maggots infestation. Next slide. So this is a video of the wound. Here you can see the maggots beneath the undermined edge of the wound. Next slide. So the wound examination shows hypergranulation tissue along with the pus discharged, and the depth of the wound was 2.1 centimeter. Next slide. So the diagnosis made here was the diabetic carbuncle / Prameha Pidaka. So the Prameha Pidaka occurs as a chronic stage of the Prameha. So the long-standing Prameha was suggestive of the Dushi Visha formation here. So for the management of which the Visha Chikitsa line of treatment was done, and also HbA1c was 15.6, so which also needed to be controlled for the faster wound healing. Next slide. So the treatment was planned in the two ways, that is the local and the systemic. So the local treatment here was only focusing on the general wound care, and the systemic treatment was in the form of the oral medication, that is the Nili Tulasyadi Kashaya, Vasanta Kusumakar Rasa, Dushi Vishari Golika, Chandra Prabhavit Vanga, and on the follow-up after the 30 days, the Vasanta Kusumakar Rasa and the Visha Vilvadi Golika was continued. Next slide. So these are the pictures of the before and after wound. So the depth of the wound, which was 2.1 centimeter before, has now reduced to 0.2 centimeters, and also HbA1c came down to 11.2%. Next slide. So the long-standing Prameha Samprapti in this case has led to more Dhatu Doshti, so which led to the Dushi Visha formation, and it also led to the delayed wound healing. So the formulation which are used here, that is the Niri Tulasyadi Yoga, which helped in the region of the Visha Vranaropana and also Rakta Prasadaka action. And the next is the Dushi Vishari Gurika, which also helped by the Vishagna, Kushtagna, and the Rasayana properties. And the last is the Vishavilvadi Gurika, which helped through the Kapashamana, Vishara, and Rechana properties. Next slide. So coming to the conclusion, in this, the long-standing Samprapti of the Prameha, which developed the Prameha Pidaka, we had to consider the Samprapti of the Dushi Visha formation here. So the Visha Chikitsa was the main line of treatment, along with the blood glucose level management. So the basic wound care and all the above treatment has successfully improved the patient's condition. Thank you.
So the time taken is 5 minutes and 6 seconds. The panel is open for discussion.
Dr. Neeraja, you said that since 20 years he was on medication for diabetes. So, still, what is the nidana exactly for the formation of wound initially?
Sir, the wound was actually in the form of a blister before. So then after incision and the drainage, it was made into a open wound, so which was not in the position to heal. So the patient approached here. Sir.
No, my point is like what are the classical nidanas of prameha which are observed in this patient? Because in the initial slide as well as in the conclusion, you highlighted that for treating the pidaka, we have to treat prameha. So, and as per Ayurveda, we go for Trisutra, right? Hetulinga Aushadha. So, treating pidaka is okay. But for again reducing prameha, we have to know the classical nidanas, what are present. So, can you mention what are the nidanas you have identified in that patient?
Yes, actually, the patient was in the profession which was allowing for only for the sedentary lifestyle of the patient. So that can be one of the cause, and also along with the non-vegetarian food habits.
So was it indicating Kafaja Prameha or
Yes,
Pittaja or Vataja?
Yes, Kafaja.
Okay. Thank you. No questions from my side further.
Okay, thank you.
Good evening, doctor. It's a nice presentation with your all reports. Can you explain whether you treated only prameha or simultaneously you treated with like a mamsajanya vyadi, like medojanya vyadi? Rona is involved with both the two, na?
Yes, sir. Sir, for this condition, actually the main focus was only on the wound healing, sir, because the patient was not in a position to walk properly.
Okay, thank you. My side, there is no questions.
Okay, sir. Thank you.
Exactly what are the gunas which have influenced for this prameha pidika? And can you name exactly the name of which prameha pidika it is?
Sir, actually, when the patient actually first approached here, it was already in the form of the open wound. So actually before that, as whatever the patient has explained us, it was in the form of a blister. So we can say that it was like the Sharavika type of pidaka, sir. So we do not have a picture of that, sir.
Can you explain it on the basis of Guna Siddhanta? How this bilva has acted?
Sorry, sir.
Can you explain the mode of action based on Guna Siddhanta on the prameha pidika? How this bilva has acted?
Yes, sir. Sir, actually, bilva has Vishahara properties, sir, and also along with the Rechana Guna. And as it is said, that all the Vishahara Dravyas act by their Prabhava only, so that can be inferred from that.
Okay, thank you.
Okay, sir. Thank you.
Thank you, sir. Thank you, Dr. Neeraja.
Thank you.
Miss Faziha Maheen, are you ready?
Yes, ma'am. Am I audible now?
Yes, you're audible, but your voice is echoing.
Okay, ma'am. Shall I start?
Madam, you have
guys-
logged in with two devices, laptop as well as mobile. Please turn off one of it.
Okay. Sir, am I clear now, sir?
Yes, you are clear. Please start.
First of all, good evening all. Myself Fasiha Mahin, studying in SJGMC 3rd phase BMS. My topic is a critical review on abhishyanda as a netra roga with special reference to nidana. Slide change, sir. Introduction. Abhishyanda, abhi means
Fasiha,
towards
is it Nidra or Nidana?
nidra.
You said Nidana.
I'm
Okay,
sorry.
please continue. Okay.
I'm sorry, sir. Introduction. Firstly, abhi means excessive or towards. Shandhya means to flow. The concept of abhishyanda in netra roga has got its own significance and can be justified in following aspects. I have taken 5 criteria. Those are Sarvashreya Saptadasha. In classification of netra roga, there are 17 separate concepts of diseases explained as Sarvashrayagata roga. In that, first one is abhishyanda, signifying all the mandalas are involved in its pathogenesis. Second one is Samanya Purva Rupa of Netra Roga is specifically more or less similar to the Rupa of Abhishyanda. That is Tatra Avilam Sasamrambam Kandavarshama Upadehavat. Guru Toda Ragadhyaya Justeshu Cha Vyakta Lakshanam. When you see for Lakshanas in the Abhishyanda, including all 4 types, that is Vata, Pitta, Kapha and Raktaja, they have more or less similar to the Purva Rupa of Netra Roga. Third one is Prayana Sarva Nayana Machasyate Bhavantya Abhishyande Nimitta Mulaha. That is almost all eye diseases have their root cause as Abhishyanda. Like Adimanta, Hatadimanta, they have root cause as Abhishyanda. Next slide, sir. Fourth one, Abhishyanda is a symptom in other netra rogas like Anjana Namika, Savrana Shukla have and Klinavartma has Abhishyanda, that is Srava, having lacrimation as its symptom. Fifth one, in individuals who remain untreated for Abhishyanda, the aggravated form of all types of Abhishyanda, Vata, Pitta, Kapha and Rakta will progress into Adhimanta and may also risk loss of vision. Next slide, sir. Next slide, sir. Hetu. Abhishyanda Hetu has 2 categories, Nija Hetu and Agantuja Hetu. Nija Hetu can be considered as Samanya Netra Roga Nidana according to Sushruta, that is Ushnavi Taptasya Jalapravesha Dure Kshanat Swapna Vipareyacha Prasakta Samrodhana Kopa Klesha Abhitapa Ati Maithuna Shukta Aranala Ambu Kulatha Masha Vega Vinigraha Dhuma Nishevana Chardi Ati Yoga etc. Out of it, some of them I have listed, and also Aupasargika Nidana considered as Agantuja Nidana, that is like contagiosity, where it is considered enlisted as a Prasangat, Gatra Samsparshat, Nishwasat, Saha Bhojanat, Saha Shayasanacha, Vastra, Malya, Anulepana, that is using things that are contaminated will also cause Abhishyanda. Next slide, sir. Samprapti of Abhishyanda, three stages will be occurring: Ama Utpatti, Kleda Utpatti and Abhishyanda Utpatti. In Ama Utpatti, there will be first impairment in the Jataragni. Agni Mandita is prime cause for Abhishyanda, where it will lead to Kledaka Kapha, dearrangement in the Kledaka Kapha, formation of incomplete Ahara Rasa causing Ama. Followed by Kleda Utpatti, the vitiated Ama will enter into Rasavaha Srotas, causing Srotoroda, disruption of the conversion of Rasa to Rakta, showing Uttarottara Dhatu hindrance leads to the formation of Rakta Kleda, where it will exhibit Varna Vikruti, Sparsha Vikruti and Gandha Vikruti of the blood. Next, it will be circulated by Vyana Vayu. After this, there will be localization of all these vitiated doshas and dhatu, where there will be, if there is persistent Agni Mandyata, it will localize in areas where it is rich in Kapha and Rakta, Alochaka Pitta and Uttamanga, where it is prone for Kapha and Kapha related disorders. It will be implying that all these conditions will be moving towards Jatrurdvagata Pradesha and localized in Chakshu. Next slide, sir.
Samprapti Ghataka, dosha will be Tridosha Dushti, as we have seen in Samprapti. Dusha is Rasa and Rakta Dhatu. Agni is Jatar Agni Janya Agni Mandeta. Srotas is Rasavaha and Raktavaha Srotas. Srotas Dushti is Ati Pravruti, as there will be lacrimation. Udbhava Sthana will be Pakvashaya. Bheda as described Vata, Pitta, Kapha and Rakta. Next slide, sir. Clinical features. I have enlisted Vata, Pitta, Kapha and Raktaja Abhishyanda specific clinical features where it will show the Vata dominance, Pitta dominance, Kapha dominance and Rakta dominance. Here in Vata, Nistoda, Stambha, Roma Harsha, Sangharsha, Parushya, Shiro Abhitapa and Shishira Shruta. That is lacrimation and symptoms whatever they will be having Vata dominance. Then Pitta, similarly, Daha, Prapaka, Shishira Abhinanda, Dhumayana, Vashpasya Samushaya, Ushna Ashruta. And the Pitaka Netrata, discoloration of the eyes will be in yellowish color. Kapajabhishyanda, Ushna Abhinanda, Guruta, Adhishota, Kandu, Upadeha, Atishitata, Pichila Srava. Coming to Raktajabhishyanda, Tamrashruta, Lohita Netrata, Nadya Samantat, that is sinusitis formation, Ati Lohita, Rakta Ashru, Dushika, Rakta Mandala. These symptoms will be exactly similar to Pitta Jabhishyanda. Hence, Pitta Jabhishyanda and Rakta Jabhishyanda Chikitsa will be in similar manner. Next slide, sir. Abhishyanda Chikitsa, first of all, in all Netra Rogas, we will classify it as Sa-Ama condition or Nirama condition. If there is Nirama condition, we will directly proceed into the main procedure. If we see Ama condition, we will have conditions like Prapaka, Daha and irritation kind of things, to which we will first specify Ama. Here I have mentioned that Langana for 5 days is told in these disorders to reduce Ama from the body. Next, followed by there will be Ama. Specification of Ama will be carried by Seka, Pradeha and Pitta Anna Seka for a period of 4 days, which will cause Ama Parshana in Akshirogas. Whereas Anjana, Purana and Kwasapana are avoided in Amavasta as will aggravate the condition, Ama having more Kapha type of Lakshana. Next slide, sir. In Samana Chikitsa of Abhishyanda, we will be going for Rakta.
Your time is up. You've already taken 6 minutes.
We will be having Vata Pitta Kapha followed by Rakta Mokshana and Snigdha Virechana. Next slide, sir. Next. Nidra and its significance in Abhishyanda. Ma'am, next slide. Next slide, ma'am. As in particular to Abhishyanda, we will see Nidra in Nidana, Nidra in Samprapti, Nidra in Kapaja Abhishyanda, Nidra in Chikitsa. I have related Nidra and Abhishyanda because Nidra as Abhishyanda being Tridosha Javadi, Vata Pitta Kapha when they get vitiated has direct link on Nidra. And in Samprapti we have seen Jata Agni Janya Mandata. In Sushruta Sthana we see Agni Mandya Nidana and Swapna Viparya Yacha. In Kafaja Abhishyanda there will be Kapha is Rasopi Sleshmavat. Rasa having more or less similar qualities to Kafaja Abhishyanda. There will be problem. Nidra, Ati Nidrata and Alpa Nidrata will be seen. In Nidra Chikitsa, we will be in Nidra in Chikitsa. For Abhishyanda Chikitsa, we involve Vidalaka, Seka, Tarpana and all after Niramavastha. Those local therapeutic procedures will be having a local action on a Sukha Swapna Prabodhana as mentioned in Ashtangaruda and Sushruta. Next slide, sir. Here I have mentioned about Nidra as Nidana in detail. Swapna Viparyacha as Nidana. In Samprapti we will see Nidra Nasha, Ati Nidrata or Alpa Nidrata. Nidra in Kafaja Abhishyanda, Rasopi Shleshmavat can be seen and hence related to Kapha Vruddhi. Nidra in Chikitsa by seeing on the
time is up. You have already taken 8 minutes.
Thank you, ma'am. Last one slide, can I say?
Yeah, you can finish it off, but it will not be counted.
It's last slide. In contemporary relation, it is considered as a conjunctivitis where Nidra is seen in 2 types. Nidra is affected in 2 types. That is symptom related and potential cause for exacerbation. Seeing the causes, seeing the lakshanas of conjunctivitis like dryness and irritation and sweating will also cause hampering in the sleep, and potential causes like using of lens while sleeping and contagious diseases having infected cloth and pillow sharings. Thus, I would like to conclude that my topic was to establish the link between Nidra and Abhishyanda. Hope I have reached my point. Thank you, sir.
So the total time taken is 8 minutes 36 seconds. And I request all the participants to please stay in the timeline.
Asiya, if you could justify the points with special reference to Nidra initially, it would be good because the title you have kept Nidra and everything you explained in the end. So please make sure next time you don't do such things, okay? Okay, thank you. No questions from my side. Okay, thank you.
Yeah, nice collection of the matter related to the subject. There's no any question from my side.
Thank you, sir.
Few things needs to be corrected here. What is the role of Kledaka Kapha and Samana Vata?
Samana Vata will help in the movement of Dushita Dosha and Dushita Dosha and Dusha in Samprapti, sir. Whatever is Dushana taken will be circulated by Samana Vayu.
Samana Vata. It is, what is the role of Vyana Vata then?
Vyana Vata assists the movement, sir, but here in Samprapti of abhishyanda, Vyana Vata was mentioned.
Vyana Vata is involved, no?
Yes, sir.
Not
If
Samana. Okay.
Thank you, sir.
Thank you. Thank you.
Thank you, sir.
Thank you, sir. Thank you, Ms. Faziha. Our next presenter is Ms. Pradnya Patil.
Am I audible and visible, ma'am?
Yes, yes, you are audible. Just give us a couple of minutes to share the screen.
Okay.
You're ready?
Yes, ma'am.
Your time starts now.
Good evening, everyone. I am Pradnya from Sri JGCHS Ayurvedic Medical College, Ghataprabha, and my topic of presentation is comparative analytical study as well as antimicrobial activity of Bakuci Phala and Chakramarda Phala with special reference to Abhava and Pratinidhi Prakarana. Next. Next slide, please. As we know, the concept of Abhava and Pratinidhi has been explained in Bhava Prakasha, and in the absence of Abhava, that is extinct drug, we can use the Pratinidhi drug. Study rationale, Bakuci is a standard for skin ailments, but scarcity often necessitates the substitutes. The substitute we are using here as mentioned by Bhava Mishra is Chakramarda. Next slide. Aims and objectives: to evaluate the concept of Abhava and Pratinidhi Prakarana, to conduct the preliminary pharmacognostic as well as phytochemical evaluation of both the drugs, to compare the antimicrobial activity of Bakuci Phala and Chakramarda Phala. Next slide. Drug profile: as we know, the Chakramarda Cassia tora, it is Tikta Kadu as well as Ushna. It is mainly indicated in Kushta, Dadru as well as Krimi. The key constituents include the amodine, anthraquinones as well as chrysophenol. Next, the Bakuci, it is Tikta Katu Ushna. It is also mainly indicated in Kushta, Krumi as well as Shvitra. The key constituents are soralin, isosoralin as well as Bakuciol. Next. Next slide, please. Methodology: authentication of the drugs were done at Ayush approved drug testing lab in Kahir Sri BMK Ayush lab, Belgavi. The physiochemical analysis, ash value, moisture content as well as extractive values were also determined at the same lab. Phytochemical screening, that is qualitative tests for steroids, alkaloids, flavonoids and tannins were also done at the same lab. Next. For antimicrobial study, you can see we have used a wide variety of organisms. That is, we have used gram-positive organism, that is Staphylococcus aureus, gram-negative E. coli and Pseudomonas aeruginosa. In fungal, we have used the Aspergillus niger as well as Candida albicans, which are mainly responsible for causing the skin diseases. The method we have used for culture is Muller-Hinton agar couplet method. The standards against which we have tested both the drugs is antibacterial, that is ciprofloxacin, and antifungal, that is fluconazole. Next. The result you can see total as 7:4, acid insoluble as 2:0.1, alcohol soluble extract 19:8, and water soluble extract 20:19. Next. Result phytochemical analysis in both the drugs, you can see the commonalities, that is both the drugs tested positive for carbohydrates, flavonoids and tannins in both aqueous as well as alcohol extract, but the Bakuci tested positive for steroids in aqueous extract, whereas chakramarda tested positive for anthraquinone glycosides in alcohol extracts. The thin layer chromatography showed Bakuci having the 18 long wave bands, whereas chakramarda showed 8, which means Bakuci has more chemical complexity in comparison to chakramarda. Antimicrobial screening reports, you can see here we have got negative results at our tested concentration. Aqueous extracts of both Bakuci and chakramarda showed no zone of inhibition at concentration up to 100 microliter against selected strains, whereas the standards, that is ciprofloxacin as well as fluconazole, showed significant dose-dependent zone of inhibition. We can interpret that both trial drugs exhibited lack of activity at the tested concentrations, reinforcing their pharmacological similarity in this context. Next. You can see here I have added only one, that is E. coli culture, because there was slight limitation. You can see in the first image, that is the against the ciprofloxacin, there is a clear zone of inhibition, whereas the next one is Bakuci and next one is chakramarda. There is clearly no any zone of inhibition formed. Next. Discussion. The identical phytochemical signature, that is carbohydrates, flavonoids, tannins, support the classical view of chakramarda as substitute. The absence of antimicrobial at the low concentration. We have used aqueous extract mainly because we give the mainly medications in the form of kashaya. Next, classic text prioritize similar rasapanchika for substitution, which both drugs largely share. Next slide. Conclusion is Bakuci can be effectively replaced by chakramarda when unavailable on the basis of classical properties and phytochemical profiles. Future scope, further studies using higher concentration, that is more than 100 microliters, and in different solvents might yield the different result, that is antimicrobial potential. Thank you very much.
Sir, the time taken is 5 minutes 31 seconds.
No questions from my side.
Okay.
So I need a clarification regarding on the basis of Ayurveda, and I congratulate whatever you have done it, but still where the Bakuci or which kind of creamy Bakuci is indicated, and when it comes to the chakramarda, again, which kind of creamy it is indicated?
Sir, we tested the both drugs because both were indicated for mainly skin.
I'm asking you because Vidanga is also creamy, Nimba, everything.
Yes. Yes.
Can you highlight something about basics of Ayurveda? Whether it acts on Purisha Krimi or Chakramarda and Bakuci?
Yes, sir. Based on the indications, that is kushta as well as shvitra, we can say that they act on Rakta Chakrami, sir.
Both act on Rakta Chakrami?
Yes, sir.
Is this an reference available regarding Chakramarda in our Bhratrais?
Sir, regarding Bakuci, it's available. It is mentioned as Somaraji in synonyms in Charaka. Regarding chakramarda, it is mentioned as Edagarja.
In which context?
In Shakavarga, sir.
Okay. Okay. In Rakta Chakrami, it is acting.
Yes, sir. We can interpret it based on the indications.
Okay. Okay. Thank you. Thank you.
Welcome, sir.
Yeah, nice presentation and analytical study. No question from my side.
Okay. Thank you. Thank you, Ms. Pradnya. Our next presenter is Dr. Akanksha Gaur. Dr. Akanksha Gaur.
Yes, ma'am.
Are you ready, ma'am?
Yes, ma'am.
Your time starts now.
Good evening, everyone. Myself, Dr. Akanksha Gaur, final year PG scholar from the Department of Panchakarma from SVM College of Ayurveda, Udupi, and under the valuable guidance of Dr. Niranjan Rao, sir, HOD of Panchakarma, I am hereby presenting on the topic Understanding Traumatic Spine Injury in Ayurveda and Role of Marma Chikitsa therein. Next. Coming to the introduction, traumatic cervical spine injuries can lead to significant neurological deficits. The damage at cervical level may result in weakness of both upper and lower limbs due to spinal cord compression. In Ayurveda, trauma to vital anatomical structures is described under Marmabhigata. The cervical region includes important marmas such as Krikatika marma and structures corresponding to Anspalaka, which are considered under Vekalyakar marma. Right. Next. Now coming to the case presentation, a 36-year-old male patient came with a presentation of loss of strength in both upper and lower limbs after a traumatic incident. The MRI reports revealed short segment cervical spinal cord contusion at C2 and C3 associated with soft tissue injury, mild prevertebral hematoma extended from C1 to C4, and a suspected undisplaced fracture with edema at C6. The clinical examination showed reduced muscle power in all the 4 limbs along with the restricted cervical movements. Next. Then Ayurveda intervention was done and the management was planned on the basis of principles of Vatshamana, Brahmana, Sroto Shodhana and Marma Chikitsa. Next. The phase 1 of the treatment started from 27th December 2024 till 15th of March 2025. And it included Alepa, Rajayapan Basti, followed by Matra Basti with Varahavasa, Dhanyamla Dara, Dashmul Parisheka. And Shaman Aushadhis included a combination of Godanti, Avipattika, Rasmanikya, Rasindura, Sehacharadi Kashaya, Shiva Gutika, Rasraj Rasa, Gandhatela. Next. The phase 2 started from 30th June till 15th of July. And it included Pidichil, Rajayapan Basti, followed by Matra Basti with Varahavasa, Pindasveda. And the Shaman Aushadhis included Khanjanikara Rasa, Ashwagandha Grita, and a combination of Godanti, Avipattikar, and Samir Pannagarasa. Next. The phase 3 was from 15th of February 2026 till 22 February 2026, and it included Mashapindasveda, Rajayapan Basti, and Shaman Aushadhis included Khanjanikara Rasa, a combination of Godanti, Avipattikar, Swarnavanga, and Ashwagandha Grita. Next. Now this is the before and after videos. Can you please play the video? In the before, there was a very restricted movement, as we can see, and the patient was also not able to walk. And in the after video, it was not played right now, I don't know, but the patient was able to walk on his own. Next. Now, before and after treatment, muscle tone and muscle power was noted, and there was a significant improvement. Also, deep reflexes and superficial reflexes also showed a significant improvement, and flaccidity was also decreased. Next.
Now, as stated in Sushruta Sharira, Shirogrivo Sandhane Krikatika, Tatra Chal Mudhata. Now, coming to the Samprapti of Marma Ghata, the Abhigata leads to Vat Prakopa, which in further leads to Raktamamsa Sanayu Dushti, which leading to Srotarodha, causing Shula Supti Stamba, and ultimately leading to Vaikalya, that is disability. Next. Now, physiological evaluation of Marma. As we all know, Marma are crucial for analysis of a disease's prognosis. The Vikriti brought on by vitiation of a certain dosha is eliminated by stimulation of a particular Marma sthana. It maintains tissue's prakriti and restores its function. Marma mostly treats the Vata dosha, and depending on the involvement of Vata, different Marma points such as Pran, Saman, Apan, and Udan Vata are taken into account for Vata Vyadhi. By eliminating harm, they also assist in cleansing the pathways and enhancing body circulation. Now, Marma as healing approach, it opens blocked srotas, pacifies the Vat dosha, removes arm and vitiated Vat, which may lead to rigidity. Next. Coming to the conclusion, as already stated, traumatic cervical spine injury can lead to severe neurological impairment and disability. In this case, integrative Ayurvedic management resulted in significant functional recovery. Basti and Brahmana therapies played a key role in restoring Vata balance and neuromuscular function. Thank you. Sir, the total time taken is 5 minutes 14 seconds.
Please share the PPT. Akanksha, Dr. Akanksha, first I thought when the slide was about Marma Chikitsa, so as everyone know, the Marma what we feel like Marma Chikitsa, like putting the pressure in different Marma sthanas, right? So I thought that, but later
Yes, sir.
I came to know. So what is the exact significance of using that word Marma Chikitsa? This is first question. And second is, how did you procure Varahavasa?
Sir, there was the patient had a traumatic injury, so it was Marma Bhita, which at this point Marma Chikitsa. And Varahavasa was procured like with the like initial Vasa was that of the Varaha was taken, and then it was boiled continuously till it melted, and then it was used.
So I'm not getting, because all the treatments given was Basti and all these things. So still why you choose the word Marma Chikitsa? Just is it because Marma Ghata was the case?
Yes, sir. Which
Then it could
included
be Marma Ghata Chikitsa would be appropriate, I feel, because the word Marma Chikitsa will create a confusion.
I congratulate, but still I would like to know the difference between whatever the treatment adopted by you. One is Sahacharadi Kashaya, Dhanyamla Dhara, Shiva Gulika, right? Avipathyakara, Godanti, everything are, I think, more towards Kapahara action, right? And you are giving Rajayapanavasti. And when it comes to Panchakarma, in what context the Marma Paripalana is explained? In Charaka, where it is explained.
Sir, Rajapan Basti was planned because of the there was Mams Dorbalya in the patient. So it was included as Panchkarma in that. And Dhanyamla Dhara, this all was done as Svedana to give a Svedana effect. And rest all the Shaman Aushadhis were given to enhance the neurological deficits and to prevent the Vata Prakopa, which was caused due to the Marma Bhigata.
Question is, you are giving Yapana Basti, right?
Yes, sir.
And you are doing Tarpana one side and you are doing Apatarpana on another side by giving those medications. Kodanti, Sahacharadi Kashaya.
Say, sir, when as the
Hello.
Yes, sir. Sir, am I audible?
It is audible. So it is Kapahara
Sir, Shiva
Gulika.
Yes, sir.
Because if you go through the Palastutis, you'll get almost all the Kapaja Vikara only.
Yes, sir.
Right. My last question is, Rajayapana Basti is which kind of Basti it is? Siddha Basti or
Sorry, sir, I didn't get your question.
is it an Siddha Basti? Siddha Basti?
Yeah,
Rajayapana Basti
yes,
is
sir.
it an Siddha Basti? Okay, thank you.
Yes.
From my side, there is no question. Nice presentation with the case improvement. Thank you.
Thank you, sir. Thank you, Dr. Akanksha. Our next participant is Ms. Kavyashri HR.
Yes, ma'am.
You are ready?
Yes, ma'am.
Your time starts now.
Namaste everyone. Myself Kavyashri from 3rd Phase BMS STGMC Koppal. Under the guidance of Dr. Suhasar, I am here to present a title entitled Bridging Ayurveda and Modern Pharmaceutics Sublingual Tablet of Shwasahara Gana for the Rapid Relief in Shwasa. Next, ma'am. Firstly, background study Shwasa as Ashivisha. Kapha Vatatmaka Vedo Pitta Sthana Samudbhavav Hridayasya Rasadhinam Dhatunam cha Upashoshani Mitya Upacharita Krudva Hata Ashivisha Viva. Shwasa is mainly Kapha and Vata dominant. In nature, they originate in the side of Pitta, which results in the depletion of the Rasadi Dhatus, and when the person indulges in Mitya Upachara, then it aggravates and the result as death, just as fatal of snake venom. Next. Here, prevalence rate is chronic respiratory diseases affecting approximately 7.1 to 7.4% globally. India mainly focuses on holds 32% of global disability adjusted life year from the chronic respiratory diseases. Next. Here, objectives to formulate the sublingual tablet using Shwasahara Gana Dravyas for the rapid therapeutic action, to explore the rationality between the sublingual route and the oral dosage, to evaluate the Ayurvedic pharmacological properties of selected dravyas, and to enhance the bioavailability, and to access the potential integration of Ayurveda with the modern pharmaceutics in respiratory care. Next. Materials and methods. Classical Ayurveda has classical text has Shwasahara Gana Mahakashaya, and it has bronchodilatory, anti-inflammatory, mucolytic, and expectorant properties. Next. In Shwasa Chikitsa, mainly Vegakalina and Avegakalina Chikitsa has been seen. In Vegakalina Chikitsa, Atyayika Chikitsa plays an important role. Here, sublingual action with respect to Atyayika Chikitsa, sublingual route of drug administration refers to the drug administration under the tongue. It is 10 times greater than the oral route. Advantages like rapid onset of the action, and it passes the first pass hepatic metabolism, good absorption due to the highly vascularized surface area. Next. Understanding Shwasa Samprapti,
मारुतः प्राणवाहिनी श्रोत्यस्याविश्यगुप्यति उरहस्त कफमुद्धूय हिक्का श्वासान् करोति सः घोरान् प्राणौ परोदाय प्राणिनां पञ्च पञ्च च. Due to absence of ciliary movement in the respiratory tract, the particles which are accumulated is not excreted. Their colonization of the bacteria occur, infiltration of neutrophils to the site, and the mucus production and shwasa. Here mainly vatanulomana, kapha vilayana and kashana is done. Next. Shwasa with respect to bronchial asthma, it is an reversible airway obstruction, bronchial hyper-responsive and repeated episodes of the symptoms. Here mast cell activation has been seen, release of the mediators, histamines and bronchoconstriction, mucus secretion, airway narrowing and symptoms are seen. Next. Discussion mainly here the Shwasa Chikitsa principles are Brahmana, Shamana and Kashana. Why only the I have selected sublingual tablet is sublingual supports in the Brahmana by preserving the tissue strength and preventing dhatukshaya. Importantly, the sublingual administration avoids the aggressive depletion of the therapy like Kashana and it supports the Shamana and Brahmana therapy. Next. These are the Shwasahara Mahakashaya Ganas like Shatti, Pushkaramula, Ela, Hingu, Surasa, Jivanti, Tamalaki, Chanda. These are the properties like antihistamines, anti-inflammatory, antimicrobial, immunomodulator, antioxidant, and cardioproductive, etc. Next. And let us understand Urdhvaga Dhamani Sharira with respect to a lingual artery where the 10 dhamanis divide into 2 Vata, Pitta, Kapha and Rasa Rakta. Here samely the sublingual arteries originate from the lingual artery which constitutes the primary blood supply to the tongue, and these are carotid artery originate splits into a smaller blood vessels so the action can be seen. Next. Conclusion, sublingual administration of Shwasahara Mahakashaya Ganas provides the rapid, effective Shamana and Brahmana. It is the novel fast acting and supports the Brahmana by preventing Kashana. These are my references. Right drug, right route, right time, more precise and effective. Thank you.
Thank you. So the
Ma'am, your voice is not audible.
time taken is 4 minutes 23 seconds.
Kaveshri, is it just your idea or you have already done some work regarding this?
No, sir, just an idea.
What are the challenges in making sublingual tablets?
Yes, sir. There are many challenges which we face. So I have taken that if we think that challenges are more, then we could stop it. So that I have taken why we can't do it and we can make it. Like making sublingual tablet is difficult, but giving a try will be good. So that I thought that it can be made.
So you want to use all the dravyas mentioned in the gana or any particular dravya?
No, sir. I want to use everything.
Thank you.
Thank you, sir.
Congratulate the presenter.
Thank you, sir.
Of course, many challenges will be faced. Do you have any brief idea regarding in which form exactly? Of course, you are telling it in a tablet form. How to execute or any idea you have?
Yes, sir. I'm
because
thinking.
Because again, Churana we are giving already.
Yes.
So, how to potentialize any idea you thought? Or
yes, sir. I am thinking now I have started the how to procure and how to authentize the raw drugs, and I am discussing with the Department of Rasya Shastra and Vaishajya Kalpana, so that it is helping me to understand like procuring the drugs and authenticating it from the research lab, and then making the churna out of it, and then adding the binding agent and making it.
Okay, thank you. No questions.
Yeah, my side, there is no questions, madam.
Okay, sir. Thank you.
Thank you,
Kaveshri. And next presenter is Dr. Divya.
Yes, ma'am.
You're ready?
Yes, ma'am.
Your time starts now.
Good evening, everybody. My topic of presentation is clinical management of Dadru kushta, a case study. Next slide. So here is a case scenario where a female patient of age 67 years came with a complaint of multiple circular reddish lesions associated with severe itching and burning sensation. The site found were bilateral axillae, bilateral groins, bilateral inner thighs and waist, and the duration for about 6 months. The aggravating factors were found to be on exposure to sweat and during night time. So on interrogation, Purva Vyadhi Vritanta, she is not a known case of diabetes and hypertension, and even all other family members doesn't have similar complaints. Next slide. So under personal history, appetite and bowel was normal, and in micturition, occasionally it was associated with burning sensation, and even the sleep was disturbed due to intense itching in the night. And on examination, the site, as I mentioned earlier, it was bilateral axillae, bilateral groins, bilateral inner thighs and waist. And the type of lesion was multiple patches where it had raised and well-defined borders, and the shape was circular in some, and some it was the whole patch was it is irregular, but the inside it had a distinct circular patches. And then color was reddish, and associated symptoms were severe itching and burning sensation. Next slide. So coming to Nidana, in Aharaja Nidana, the patient had habituated to Katu and Amla Ahara Seva and also Nitya Dadi Sevana. In Viharaja, after interrogation, we came to know she was practicing improper hygiene like bath only once in 3 days. And Purvarupa consists of Kandu and Raga. When we see the Samprapti, due to the Ukta Nidana Sevana, there was the aggravation of Kapha and Pitta along with the involvement of Krimi, and hence vitiation of Twak, Mamsa, Ambu and Lasika. And then the Sthana Samsraya was found in Twak in bilateral axillae, groins, inner thighs and waist. And the Lakshana seen were Dadru Mandala associated with Kandu, Daha and Raga. Next slide. This was the initial treatment protocol where she was given Krimikutar Rasa 1 TID and Gandhak Rasayana 1 BD, Arogya Vardhini Vati 2 BD, Sudashekra Rasa 2 TID, Nimbadi Kashaya 15 ml BD, Tulsi bathing powder for external application and external wash, Pendathaila for external application at night, and Gandha Karpura also for external application in the morning. Next slide. So treatment procedures, first it was Sarvanga Utsadana with Daru Haridra Kushta, Lodra Churna and Pendathaila, and then Sarvanga Parisheka with Dashamula Kwata, followed by Sadhyo Virechana with Abhipatikara Churna, which yielded only 2 Vegas. Hence next day, Sadhyo Virechana with Nimbamritadi Aranda Thaila was given, which had 5 Vegas. And then Anuvasana Basti with Nimbamritadi Aranda Thaila was given. And then next it was changed to Bala Gudichadi Thaila as it has also Vata involved, means Vatahara action. And then Niruha Basti was given, followed by Ahin Virechana with Trivrit Lehya. Next slide. So on advice on discharge, it include Gandhaka Rasayana DS 1 BD, Arogya Vardhini Vati 1 TID, Patola Kataronyadi Kashaya 15 ml BD, Aragwadadi Kata for external wash, Pendathaila for external application, and Disora lotion for external application. Next slide. So this is the result before and after treatment. We can see there is a distinct improvement in the appearance of the lesion, and also the borders also started to it has come to the skin level, and the reddishness was also not seen. Next slide. So first day Kandu was severe and Raga, Daha, everything was here. After 14th day, Kandu and Raga reduced to 2+, whereas Daha was having 1+. And at the 30th day, only Kandu was the persisting symptom, and Raga and Daha was completely absent. Coming to discussion, the Shamana Aushadhis like Gandhaka Rasayana, Aroga Vardhini Vati, Sutashekra Rasa, and Nimbadi Kashaya, these were selected to specifically to target the kushta, and also as it is predominant in as the Dadru kushta is predominant in Pitta Kapha, these medicines were selected. Krimi Kutara Rasa, it has Krimihara action. As I said previously, in the patient involved in the practice of improper bath and improper practice of hygiene. So due to bathing once in 3 days, there was involvement of Krimi. So Krimi Kutara Rasa was given to eliminate the Krimi there. And Gandha Karpura and Tulasi bathing powder
was given to reduce the kandu as it, and also it acts as tvachya. Pinda taila, it is mentioned in Vatarakta Adhikara. So it has predominant of Pitta Vata action. And here in this condition, Daha was more and Raga was also more. Hence, Pinda taila was included, advised. Then next slide, Utsadana. Kandugna, it has action Kandugna and it is indicated in Kapha Pitta Shudra Rogas. And in Parisheka was given as it is body is preparing for Shodhana, and also toxins will be eliminated via sweat, hence Parisheka is taken. And then Sadhya Virechana was given to eliminate the krimi, and also it will give the quick relief of symptoms. Hence, Sadhya Virechana was opted. And then followed by Anuvasana Niruha Basti was opted for Shodhana. For Shodhana, Basti is indicated in krimi, hence it is adopted. And then Virechana was finally it was given for the complete Shuddhi, and thereby it provides systemic cleansing and enhanced therapeutic outcome. Gandak Rasayana and Arogyavardhini Rasa both are Tvacha and Kushtagna, and also acts as a Rasayana. Patola Kadroni Kashaya, it is Kapha Pitta Hara. Hence it is opted. Aragvadadi Kwata, it is Kafagna and Kushtagna, and hence it alleviates Kandu. Desola lotion is a proprietary medicine which has a Kushtagna dravyas like Gandhaka, Aragvada, Karanja, etc. This will also aid in symptomatic relief. Next slide. So these are the references. Thank you. And this case was successfully treated by Dr. Tripathi sir of Manasa Roga. Thank you. So the total time taken is 6 minutes 30 seconds.
Dr. Divya, what is like special thing you noticed in this case? Because as in all the Dadru cases, we can see this, the treatment protocol, everything. So why did you select this case for presentation? Like, what is the unique thing you observed?
Generally, we don't prescribe Basti in case of in Kushta cases. In this patient, we have taken Vasti, and also the selection of drugs also were like Arogyavardhini Vati and Kalkadravyas include the Daru Haridra Churna, Manjishta Churna, Lodra Churna, which also has Kushtagna action. And as there is an involvement of krimi, we choose Vasti here. So I thought this may be ideal.
You should have highlighted that in the title or somewhere, because
Okay, sir.
even Virechana has been planned, so it was not highlighted.
Okay, sir. Okay.
How many days patient was suffering from the Dadru Kushta?
6 months, sir.
6 months.
Yes, sir.
Okay. I congratulate for your presentation and the
Thank you,
treatment protocol also.
Thank you, sir.
Right. But still, one thing is, as how many drugs you were prescribing, one basic question is, how much quantity of Kajali can be prescribed per day? For your presentation, I'm not asking, right? Because you are presenting, I'm asking you. So, how much quantity of Kajali can be prescribed per day?
I'm not sure about it, sir. I'll refer, sir.
What are the other? Can you name the medicines which contain Kajali here?
I don't know, sir.
No. Of course. One suggestion for all the presenters here. So better we should come up with an preparations, right?
Yes, sir.
Okay. So that is what need of the hour now. Ayurveda has to survive. We need to upgrade ourselves. Because for krimi, in the modern science, they will be prescribing 1 or 2 tablets. That's enough. Right?
Yes,
of course, that science has limitations, but still we should develop ourselves to that extent so that in 1 or 2 tablets with so much of days, we can treat this. Right? Fluconazole is with this dosage, with this repetition, for so much of time, if it is prescribed, it will cure this much percentage of an disease. Right?
Yes, sir.
Right? Being an young scholar, we should keep ourselves updated for all these things. Right?
Yes. Yes,
And
sir.
one last question. For a skin condition, how many weeks of oral medications of kushtagna dravyas or krimigna dravyas will efficiently manage? For nails, I may say around 3 weeks. Minimum 3 weeks are required. And for skin, can you explain how many weeks of treatment is required, or minimum how many weeks we should wait?
Sir, I think it depends on the chronicity, alva, sir.
Yeah, of course, it depends on the chronicity. But still, we are answerable, no? We should develop our science in a much better way. Right? Yeah.
Yes, sir.
At least you should, if of course you have done Panchakarma, when it comes to the OPD level, you should tell the patients, of course, I may require around 6 weeks of time, 3 weeks of time. That is the confidence what we should carry in our OPDs. Thank you.
Sir. Thank you, sir.
Yeah, there is no questions. A nice presentation with the case reports. Thank you.
Thank you.
Thank you, sir. Thank you, Dr. Divya. Our
you.
next
Thank you.
participant is Dr. Aditya Arulkar. Dr. Aditya Arulkar. Am I audible to you, Dr. Aditya Arulkar? You're not audible. I'm able to see you, but you're not audible. Please check for your connection. Dr. Aditya, you're not audible. Please check for your connection. Until then, we'll move on to the next presenter. Dr. Durga Priya, Dr. A. Durga Priya.
Yes, ma'am. Am I audible, ma'am?
Yes, please switch on your video.
Yes, ma'am.
Your time starts now.
Good evening, one and all. Myself, Abotula Durga Priya from Department of Dravyaguna Vijnana, MD first year. Next, my topic is role of Avalgujati Depam in the management of Dadru Kushta, a case study. Next slide, please. Skin disorders are growing rapidly, and it not only affects the person physically but also mentally and socially. One of the major drugs used in treating kushta is avalguja, also known as Bakuci, having tikta katu prasa, lala ruksha gunas and ushnavirya. This case report proves the efficacy of avalgujadi lepam in Dadru kushta, also called as atopic dermatitis in contemporary medicine. Dadru is a skin disease mentioned in Shudra kushta by Charaka, while Sushruta and Vagbata mentioned it in Mahakushta. It is a Kapha Pitta predominant disease characterized by Kandu, Raga, Pidaka and Utsanna Mandala. The present study focuses on the role and efficacy of Avalgujadi Lepam in patients suffering from Kushta, as particularly mentioned in Bhava Prakasha Kushta Rogadikara in Madhyama Kanda. Next slide, please. A 35-year-old male with no ongoing systemic disorders, with no prior surgical history, came to OPD with Kandu, Utsanna Mandala, Krishnavarna, Pidaka formation. After this, the patient had previously undergone Shamana Chikitsa for the same, but found partial relief. After the symptoms relapsed, considering the chronicity of the disease and dosha predominance, a treatment plan was devised addressing both. Next slide, please. Assessing the diagnostic parameters that Darshana Pariksha, the shape is circular in shape with 3 in number. The size varies from 3 into 3 centimeter, 2.5 into 2 centimeter, and 2 into 2 centimeter. The color is red in color, and the nature is elevated patches. By Sparshana Pariksha, the texture is rough and the temperature is warm to touch. Next slide. The treatment plan was devised targeting both the symptoms present and the dosha imbalance happening internally. The internal medications are Gandhaka Rasayana, Shati Churna, Arogyavardhini Vati, and the external medication is Avalgujadi Lepa. Next slide. The results are for the first 7 days, there is a marked reduction in pruritus, slight reduction in spread of pedicus. There is no significant change in color or lesion size. For the next 3 days, there is no further extension of the mandala, very mild improvement in pigmentation, prominent arrest in lesion spread. For the next 7 days, no new eruptions are observed, demarcated improvement in lesion color, approximately 0.5 mm reduction in lesion size. By the end of 1 month, complete relief from itching, significant improvement in lesion color, and there is significant improvement in sleep cycle. There is a size reduced to 2.5 into 2.5 centimeter, 2 into 1.5 centimeter, 1.5 into 1.5 centimeter. Next slide. There is a visible improvement in hyperpigmentation, and the most rapid response was observed in pruritic control and arrest of lesion spread, followed by gradual reduction in pigmentation and lesion size. Avalguja having Kushtagna, Cremigna, and Raktachodha property. The properties are attributed to the correction of local pathology, reduction of microbial load, and purification of vitiated rakta involved in Dadru. Gomutra acts as a potent antimicrobial agent, facilitates deeper penetration, and enhances bioavailability of active constituents, possesses Ushnavirya. Ushna property contracts stagnation and reduces pitta-associated inflammation, thereby breaking the pathogenesis of Dadru. Next slide, please. Shuddhaharadala exhibits antimicrobial and lesion resolving properties when properly purified, supporting the reduction of thick and elevated margins. The intervention demonstrated early control of itching and lesion progression, measurable reduction in size, no reported adverse effects. The pattern of response suggests that Avalgujadi Lepam primarily interrupts the itch inflammation cycle initially, followed by structural lesion regression, aligning with both Ayurvedic doshic principles and possible anti-inflammatory mechanisms. Next slide. These are the falshrutis of Rasayana, Arogyavardhini Vati, Shachurna, and Avalgujadi Lepa. Next slide. There is an importance of the dual approach in this case. Dadru is a Kapha Pitta predominant disorder involving Rakta and Lasaka. Disease shows both systemic dosa lesion and localized skin lesions. There is a need for internal medication to correct the doshic imbalance, helps in Rakta Shodhana, reduces kleda and inflammation, prevents recurrence and chronicity, improves dhatu metabolism. There is need for external application, direct action on skin lesions, reduce kandu, controls pedicus, helps in mandala reduction, provides local cushing and Cremigna effect. Next slide. We conclude that topical use of Avalgujadi Lepam shows significant improvement in chronic Dadru, reduced pruritus, lesion spread, pigmentation, and mandala size. Next slide. These are the references. Thank you.
So the time taken is 5 minutes 50 seconds.
Thank you.
The panel is open for discussion.
Now go through previous slides. Please. Next. No? Okay. Next slide, please. Still, I stick up to the basics.
Yes, sir.
What is Lasika here?
Sir, Lasika means lymph, sir. It's not lymph, it's a pedicus are present,
Difference
sir.
between
There
this
is some
Kleda and Lasika. Sorry? Difference between this Kleda and Lasika.
Sir, here in pedicus there is some sorry, sir.
And of course, what are the Drobya Sangraha here? Kapha and Pitta, Twak and Lasika, and Rakta you said, right?
Yes, sir.
Right. Can you explain pure action of Avalguja based on those Drobya Sangrahas?
Sir, I can't get it, sir.
ये देखो आप जो बोल रहे हैं ना कफ का पित्त और इन्वॉल्वमेंट है और त्वक रक्त एंड लसिका का इन्वॉल्वमेंट है राइट
Yes, sir.
एंड अवलकुचा वेर इट acts exactly whether it acts on lasika or rakta or twak.
Sir, Avalguja acts on Twak, sir. It's a Savarnikarana of Twak, sir. Its action, its main action is
Savarnikarana.
Yes, sir. Savarnikarana of the Twak.
How many days of application is required?
Sir, actually in this patient, I give Avalgujati Lepa for 30 days, sir. Sir, there is slight reduction of mandala, and there is no further.
Because what we observed in our practice is when you apply Avalgujadi Lepa, some blisters are produced. Is it so with your case?
No, sir, I can't find any blisters in this case, sir. And some.
Especially it is used in a Shvitra to irritate the tissue levels.
Yes,
Vruna is formed, then Vrunava Chikitsa is explained in Shvitra. External application with Avalguja and everything will irritate the tissue. So you have not came across with all these things. No irritations. Thank you.
Thank you, sir.
My side, there is no any question. Thank you.
Okay, sir.
No questions from my side. Thank you.
Okay, sir. Thank you, Dr. Durga Priya.
Thank you all the judges.
Our next presenter is Dr. Aditya Arulkar. Dr. Durga Priya, you can switch off your video. Dr. Aditya Arulkar, am I audible? We still can't hear you yet. Can you please check your connection? Dr. Aditya? Okay, there might be some connection issues. We'll proceed with the next participant. Our next participant is Dolly Chandramohan. Dr. Dolly Chandramohan.
Yes. Yes, ma'am.
Your time starts now. You may proceed.
Okay. Om Brahmadakshashvi Devesha Bharadvaja Punarvasu Hutashavesha Jaraka Prabhu Tibhyo Namo Namaha. Namaste. Myself, Dr. Dolly Budpati, third year PG scholar of Trivandrum from Rajiv Gandhi Education Society's Ayurveda Medical College and Hospital, Roan. Today I am going to present Ayurvedic management of oligospermia with low motility through application of Samanya Vishya Siddhant for causative analysis and rational drug selection under the guidance of Dr. Shashikala Bani ma'am. Next slide. Oligospermia defined as a sperm count below 15 million per ml and low motility less than 40% of total motility. These are among the major cause of male infertility today. In Ayurveda, we can correlate it with the Shukradushti. Next slide. As we all are familiar with the Samanya Vishya Siddhant, so I'm not going into the details here. Later, we will see how it is applied in Hetu Nirnay and also in Chikitsa Upyogi Siddhant Nirnay. Next slide. This case study demonstrates how Samanya Vishya Siddhant, one of Ayurveda's fundamental principles, can be effectively used for both etiological analysis and for rational drug selection. Next slide. The patient was a 28-year-old male with a 6-year history of infertility. He previously undergone a hormonal treatment and even 2 failed IVF cycles, yet without successful conception. He also reported general debility and low stamina. Next slide. During detailed history taking, 4 major causative factors emerged. One is excessive intake of takra, about 1 liter daily, which leads to ruksha, laghu and drava gun vriddhi, katurats pradhanahar, ushna and tiksha gun vriddhi, atap sevan, ushna and ruksha gun vriddhi, and ati vyayam, ruksha chale laghu gun vriddhi. Next slide. Collectively, these factors does anshik vat and pitta prakop, leading to Shukradushti. Modern reports confirmed severe oligospermia with sperm count of only 4 million per ml and 10% motility. Next slide. Based on Samanya Vishya Siddhant, treatment was planned with 2 main goals. First one is removing the hetu, all causative factors producing ruksha, ushna, tikshna and laghu guna in the body. And second one is introducing opposite guna, snigdha, shita, guru guna yukta dravya. And for this, Shatavari Grita was selected because, next slide. Shatavari is snigdha, shita, guru ideal for pacifying vata and pitta in this patient, and grita enhances the same quality along with bruhan and deepan karma. The dose was 5 ml once daily with lukewarm cow milk. Pathya includes snigdha shita and laghu santarpakahar. Apathya includes avoiding excessive katu ahar, frequent and prolonged atap sevan, and ati vyayam. Here are the results. The response was remarkable. Sperm count improved from 4 million per ml to 28 million per ml. Motility increased from 10% to 50%. General debility reversed within 13 days of treatment. And most importantly, after 5 months of treatment, the patient's spouse conceived naturally and later delivered a healthy full-term baby boy. Next slide. This case highlights how classical principle, when applied systematically, can produce profound clinical outcomes. The use of Samanavishya Siddhanta allows precise identification of causative factors and ensures minimal yet rational drug selection and uses. While modern interventions like IVF may sometimes fail, principle-based Ayurvedic management can significantly enhance reproductive health safely, effectively, and naturally. Such an approach holds potential for broader application in Ayurveda in drug research and practice, especially when demand for holistic and sustainable solution is rapidly increasing. Astu. Here are the references.
So the time taken is 4 minutes and 52 seconds. The panel is open for discussion, sir.
For the treatment planned.
Sorry, sir, I couldn't hear.
Please open the slide of treatment. Can you justify Takra Sevana as a Nidana?
Yes, sir. वो जो पेशेंट है वो तक्र जो ले रहे थे उसका मलाई निकाल करके ले रहे थे, तो वो जो तक्र है वो रुक्ष बनता है और वो तक्र अति मात्रा में सेवन करना, क्योंकि एक द्रव की मात्रा 2/3 होती है, राइट, लेकिन वो अधिक मात्रा में सेवन करना विच इज ऑलरेडी अप्रोक्स 5 ग्लास ऑफ तक्र, इट इज टू मच. दैट्स व्हाई क्योंकि मात्रा, सातत्य, ये सब हेतु डिफाइन करने में हेल्प करते हैं. तो यहाँ मात्रा भी ज्यादा थी, सातत्य भी ज्यादा था, तो वो लंबे समय से ये करते आ रहे थे.
Thank you. No other questions.
Which place that patient belongs to?
अहमदाबाद, गुजरात.
उधर तो छाछ मट्ठा
यस सर.
वो तो कॉमन है ना, वो ऐसा कैसे निदान बन गया? वो तो साथ में है.
यस सर, बट वो मात्रा से अधिक था, इसीलिए शरीर में रुक्ष गुण वृद्धि हो रही है, दिख रही है, और ऑल्सो वो अधिक मात्रा में सेवन कर रहे हैं.
ओके. कैन यू जस्टिफाई दिस सद्यो शुक्रकरम पयः?
यस सर, क्योंकि यहाँ पर हेतु जो पय है, एक्चुअली सामान्य विषय सिद्धांत में यही बताया गया है कि जब सामान्य हम मतलब मासे ने मास वृद्धि होती है, लेकिन हम शुक्र देकर शुक्र वृद्धि नहीं कर सकते, तो वहां पे उनके सिमिलर गुणों को देकर वो धातु की वृद्धि कर सकते हैं. तो पय जो है उनके गुण वो शुक्र से सिमिलर है, वो स्निग्ध गुरु. तो ऐसे गुणयुक्त द्रव्य, मधुर गुणयुक्त द्रव्य लेने से वो शुक्र वृद्धि करते हैं. वहाँ पे जबकि हेतु यही थे कि रुक्ष है, लघु गुण वृद्धि है, कृष्ण गुण वृद्धि, तो वो एग्जैक्टली वहाँ शुक्र वृद्धि करने में दुग्ध हेल्प होता है.
Of course, I think you belongs to Dravaguna department, no?
Yes, sir.
Okay. Can you throw some light on regarding glucose transporters
No,
with
sir.
this specially reference to this Sadhyo Shukra Karampaya?
Okay, sir. I don't know much about that. I will go through it.
Okay. Thank you.
Yeah, nice presentation, doctor. What about the Shukra Dushti treatment you did it?
जी सर, यहाँ पे जो अंशात्मक प्रकोप हुआ वो है, एक मिनट सर, मैं स्लाइड को निकालती हूँ। यहाँ पे अंशात्मक प्रकोप हुआ है कि जो वात गुण है उनकी वृद्धि हुई है रुक्ष, लघु एवं चल गुण से, और पित्त जो है उनकी वृद्धि हुई उष्ण द्रव तीक्ष्ण गुण से। तो वहां पे उनके विपरीत गुणों से शुक्र दृष्टि की चिकित्सा की है।
Okay, doctor. Thank you.
Thank you, sir. Thank you, Dolly. We have our next presenter, Dr. Sai Reshma.
Good evening, everyone. Today I'll be presenting slides.
Just a second.
Yeah, thank you.
Yes.
Your
time
good evening,
starts
everyone. I'm Dr. Sai Reshma, final year PG scholar from SVM Ayurveda Hospital, Bangalore. My title of the study is A Multifaceted Therapeutic Framework for Managing Partial Rectal Prolapse, a Case Report. Next slide. Introduction. Rectal prolapse, in which a condition in which the rectum protrudes beyond the anus. Prevalence is less than 0.5% in general population, and which is more frequently seen in the elderly population and in females. Nirgachati Gudam Bahihi. It is a multifaceted approach adopted in which Sadvavajaya Chikitsa, Kshara Karma, Matra Basti, Gudapichu, and Prashana Aushadas are given. Next slide. Patient information. Female patient complains, 43 years old female, who is a homemaker, complains mass per rectum since 6 months. History of presenting illness. Patient complains of something protruding out from the rectum while straining during defecation. It was painless but was occasionally associated with streaks of blood. The mass of rectum was very
Ma'am, your voice is not audible.
often self-reducing in nature, requiring no?
Your voice is breaking.
Okay. History. Patient complains of something protruding out from the rectum while straining during defecation. It was painless but occasionally associated with streaks of blood. The mass of rectum was very often self-reducing in nature, requiring manual reduction. Tenesmus. Next slide. Family history. Mellitus, hypertension or thyroid dysfunction. Surgical history, she underwent hysterectomy 5 years ago. Personal history and general examination. Ahara, Shadrasayukta, non-vegetarian, thrice a week. Vihara is Shramajanya, Vyasana is nothing contributory, and Mala is intermittent constipation, Mutra 5 to 6 times per day. All exam.
Doctor, your voice is breaking. Could you please check the connectivity? You're not audible yet. The timer is paused as of now.
Connection is normal only.
Yes, you may proceed now. You're audible now.
Okay. Lymphadenopathy were absent. Next slide. Next slide. Local examination, the Sthanika Pariksha, inspection on lithotomy position, normal anal orifice and surrounding skin was normal. On straining, the small circumferential radial folds of the rectal mutinal verge with hypotonic anal sphincter admitting 2 fingers easily. Proctoscopy, easily permissible proctoscope due to lax anal sphincter. Next slide. Lab investigations, all were said to be normal. So the plan of treatment was Ksharakama under local anesthesia was planned for the patient. Next slide. Chikitsa, Ksharakama, preoperative written surgical consent was taken, part preparation, injection TT and TT xylocaine was given, and soap water enema was given. Operative notes, patient was taken in a lithotomy position, part painting and draping was done in the perineal region. Manual reduction of the rectum was done, and then Shwasahara. Same procedure was repeated circumferentially, and anal pack of the gauze soaked in Eshtimadu Thaila was put, and patient was shifted to post-op ward. Post-operative, this was the procedure which was done, and post-op medications were Tab and Loma DS, one at night, and then Triflaguglu Gandhaka Rasayana, 1 TID after food, and sitz bath thrice a day. Then followed by Matra Basti with Yashtimadu Thaila, 20 ml was done for 5 days. Then followed by Guda Pichu with Mushika Thaila was done for 15 days. The parameters before treatment, 1 week of Ksharakama and after 1 month. Mass per rectum was present before treatment, and after treatment it was absent. After 1 week and 1 month of Ksharakama it was absent. Constipation was present before the treatment, and it was rare after 1 week of Ksharakama and absent after 1 month of Ksharakama. Mucus discharge was present before treatment, and quantity has slightly reduced 1 week of Ksharakama and after 1 month of Ksharakama. Sphincter tone was hypotonic in nature, and after 1 week of Ksharakama, it was mild hypotonic, and later it was normal. The mode of action of Ksharakama is it acts as chemical cauterization, and
your time is up.
Discussion and conclusion I want to tell is there are many approaches in which there are many complications like sphincter. There will be incontinence, and later it will be there may be other complications like bleeding or post-op pain. But Ksharakama, as it is done under local anesthesia, it has very good results. Thank you. These are my references.
So the time taken is 5 minutes and 40 seconds. The panel is open for discussion, sir.
Okay.
No questions from my side.
No questions from my side.
No question, madam. Proceed for next time.
Okay, sir. Thank you, Dr. Sai Reshma. We have our next presenter, Dr. Anjali ji.
Yes, ma'am.
Give us a moment. The slide is there. Your time starts now. You may proceed.
Namaste all. Myself Anjali Gidve from the Department of Kaya Chikitsa, second year PG scholar. I am going to present on the topic of management of Dadru through Shodhana and Shamana, a case report. Next. Introduction. Dadru is a type of Shudra kushta having a complaints of Kandu, Raga, Pidaka and Mandala Udgama, and it is a Kapha Pitta predominant diseases where affecting the Tvaka and Rakta Dhatu. It can be correlated to tinea, and frequent Shodhana is to be done in the kushta, as it is said, because of Saptako Dravya Sangraha, where it is a very difficult situation where it can't treat within one sitting or something like that, and Shamana Aushadhi, repeated Shamana Aushadhi to be done. Next, please. Next, please. Methodology: a female patient of 32-year-old having a complaint of itching over bilateral upper and lower limb since 6 years. Next. Initially had reddish circular lesions with burning sensation over bilateral toes, but which had progressed to bilateral lower limbs, followed by bilateral upper limbs in 1.5 years. Aggravating factors are after bathing and application of coconut oil, and it gets more severe at night. She had presented with generalized dryness, and now the symptoms are not circular but diffused manner since 1 year, and homeopathic treatment she had taken previously but didn't get any significant relief. Next, please. Clinical findings, inspection, ill-defined irregular erythematous to hyperpigmented plaques were present. Bilaterally, it was symmetrical on upper and lower limbs, and on palpation, warmth was absent and dry, scaly and mild thickened plaques were felt. It was diagnosed as as tinea corporis on the basis of KOH mount test, where the fungal spores were present. Next, please. Treatment was given where the Virechana was given in inpatient, where the Purva Karma was done with Deepanapachana, Agnitundi Vati 4 TID for 1 day, and Snehapana with Gugulu Tiktaka for 4 days. And later, for 3 days, Sarvanga Abhyanga was given with Nimba Taila and Nimbakata Parisheka, and application of Brahant Dattapala Taila with Tankana Basta was done. Next, please. Pradhana Karma Virechana was done with after the application of after the Abhyanga with 50 grams of Trivritliya and 50 ml of Triphala Kashaya, where the total Vegas are 14, and Paschat Karma Sansarjana Krama was done for 5 days. Shamana Aushadhi on discharge was given with Panchatikta Kashaya 50 ml TID, Arogya Vardhini Vati 1 TID, then a Brahad Dantapala Taila application with Tankana Basma for external application, and for Avipatti Karachurna as for the Nitya Virechana for half TSPHS. Follow-up modifications were done where the Panchatiktaka Kashaya was replaced with Khadira Arishta because of palatable issue, 15 ml BD. Chakramarda Taila was given for external application instead of Brahatanta Taila, and Brangaraja Rasayana 1 TID was given. Next, please. Results where KH was positive before the treatment, and after Virechana, the KH mount test was negative. Clinically, the itching was reduced after 2 follow-ups, and lesions were better after 3 follow-ups, and dryness was reduced after 3 follow-ups. Next, please. Here you can see the scaly lesions were absent after the treatment and after 3 months. Next, please. Discussion part, mode of action of Virechana. Virechana was given with Trivritliya, which it is Sukha Virechaka, helps in elimination of Pitta along with Kapha dosha from Adobhaga, and Snehapana with Gugulu Tiktaka Grita helps in Dosha Udkleshana, and it is mainly said in Kushtahara also. And this procedure helps in enhancing immune response and skin turnover. Abhyanga with Nimba Taila and Nimba Kwata Parisheka, where the Nimba is said to be a Krimi Hara and Kushtahara. Bringaraja Rasayana was given as its karma is a Kafavata Shamaka and Vrinaropaka and Rakta Prasadaka. Next, please. A Panchatiktaka Kashaya was given where it is said for Kushta and Krimi Nashini. Khadirarishta was given where it is Tridoshahara, Deepana, Malanulomana, Kandugna and Kledahara. Brahad Dantapala Taila along with Tankana was given where the Brahad Dantapala Taila ingredients are Shwetakutasha, Jyotishmati and Bakuci, and Tankana helps in Lekhana property and Vrina Ropana and Jantugna. Next, please. Arogya Vardhimati, where the Katuki is the main ingredient, help in Vedana and Deepana Pachana, and Chakramarda Taila, where the Kandu, Hara and Dadru is mainly explained here. Avipatti Karachurna for Nitya Virechana and Shroto Shodhana was given. Next, please. Thank you.
So the time taken is 4 minutes and 53 seconds. We are open for discussion, sir.
Will you show me the pictures of the patient? No, that slide, previous one. Right. Is it not Eka Kushta?
No, sir, because as for the KH mounting was done, the tinea.
No,
but sir, in Eka Kushta, Kandu is not the feature, but in Dadru we can see the features of Kandu. And initially she had circular lesions, but as it is chronic, so she didn't appear with the circular skin lesions. Sir.
No.
Yes, sir.
What about Sweda here?
Sweta is there, sir. It is not absent, and she had said like because of Sweta, the itching would slightly increase.
Okay.
Yes, sir.
Okay. And
Yes,
this.
if she didn't have the symptoms of Kandu, but at that time we can take it as Eka Kushta, sir, because the lesions were scaly and little peel of could be seen, sir.
Okay.
Yes, sir.
If it was an Eka Kushta, then what
Yes,
is
sir.
the line of treatment?
So in Eka Kushta also, this Shweta Kutija application can be given, and Virichan also plays an important role here, sir.
Okay.
And as for the Shamanaushadis, external application of Shweta Kutaja Taila or Sora oil where it contains Shweta Kutaja, and even Brahantantapala helps in that condition, sir. Then for internally, Anitya Virechana can be given after Virechana of gap of 1 month. Then the medications like Kadirarishta also helps in that conditions.
How many days of this Kadirarishta can be continued? If
So
there is no,
yes, sir.
If there is no Krimi Samprapti,
yes, sir.
in Eka Kushta, if you consider,
yes, sir.
Of course, Dadru Kushta, fungal infection, everything you said. How many
Yes,
days
sir.
it can be continued?
So minimum, if we consider it as creamy, then maximum of 2 months is the maximum period, sir, where it can be given. Minimum from 15 to 2 months, 15 days to 2 months, sir, but not more than that, I think. I don't know exactly, sir, but
Okay. Gandhaka Rasayana, for how many days it can be prescribed?
Gandhaka Rasayana, as per the Rasayana course, 1 month, I think, sir, it can be given.
Okay.
Yes, sir.
Thank you. Thank you.
Thank you, sir.
No, any questions? Proceed
No
to the next one.
No questions from my side as well.
Okay, sir.
Thank you, sir.
Thank you, Dr. Anjali.
Thank you, ma'am.
The next presenter is Dr. Shruti.
Am I audible, ma'am?
Yes, ma'am, you're audible. Just a moment, the slide will be shared.
Yes.
Your time starts now, doctor. You can proceed.
Namaste everyone. Myself Dr. Shruti, second year PG scholar from Sri Sri College of Ayurveda and Hospital, Bengaluru. My topic for today's presentation is understanding the role of Achara Rasayana as a behavioral epigenetic approach in cancer prevention. So these are my contents. Next slide. Introduction. So what is epigenetics first of all? So epigenetics, it is the study of, next slide. Epigenetics is the study of how the behavioral and the environmental factors such as the diet, the lifestyle, the toxins or the stress factor which will affect our gene functioning. So whenever our body is under chronic stress, it will trigger the DNA methylation, which will in turn silences the tumor suppressors by activating the oncogenes. So whenever we are under high stressful conditions, there will be production of cortisols or the adrenaline in very high amounts. So this will create a pro-inflammatory and a DNA damaging internal environment. Next slide. On the other hand, when one follows a Achara Rasayana, which is told in Charaka Chikitsa Sthana first chapter, which includes the concepts such as the Satyavadina, Makrodaha, Himsaka, Manayasam, Nityakshiragrita Abhyasas, etc., which can be broadly categorized as Aharaja, Viharaja, and the Sadvritas, there will be a calmer and safer internal environment, which is very much necessary for prevention of any sort of the diseases. Next slide. Coming to the objectives. So to explore and integrate Achara Rasayana as a soft genomic edit and also to demonstrate how the Sattvic mind prevents the cellular rebellion. Next slide. So coming to the important part of the presentation, that is understanding the Acharya Rasayana, I have already told it can be broadly categorized as Aharaja, Viharaja and the Sadvritas. The concepts of Sadvrita I have broadly categorized into the Sharirika Sadvrita, Manasika, Dharmika, Samajika, Vyavaharika Sadvritas. So coming to the Sharirika Sadvrita, the first concept, it includes the Ashtanga Yoga such as the Yama, Niyama, Asana, Pranayamas, etc., which is told by Patanjali in Patanjali Yoga Sutras, following which is very important for prevention of the diseases. The second most important concept is Na Vega Dharanas, that is those Vegas which should not be suppressed at any cost. So in the recent eras, we have been seeing that many diseases are arised because of suppressing these natural urges. If we come to the concept of cancer, we can take the example of the colorectal cancer, where the suppression of the Mala Vega can also be considered as one of the important cause for manifestation of the colorectal cancer. So coming to the Manasika Sadvrita, here Dharaniya Vegas are important, that is those urges which has to be suppressed, which includes the Kama, Krodha, Bhaya, Dvesha, Isha, etc. So here I would like to quote the example of the Rasavaha Sroto Dushti Nidana, where our Charaka has told that Chintya Namcha Ati Chintanat as one of the important cause for manifestation of the many of the Rasavaha Sroto Dushti Vikaras. So this will highlight the importance of following the Manasika Sadvrita in prevention of the diseases. Few of the Dharmika and Samajika Vyavaharika Sadvritas I also have been mentioned here. Next slide. So Acharya Rasayana, it will influences the epigenetic mechanism, and this will lead to the biological outcomes such as the tumor suppressor activation, reducing the inflammation and telomere repair. In next slide, I have given a small sattvic protocol, that is the Dinacharyas, which will help in prevention of cancer. Next slide. So such as the pranayama, which will help in oxygenation. Abhyanga, practice of Abhyanga will help in better lymphatic drainage, and meditation will improve in parasympathetic activation, and early sleep will give a melatonin surge. So next slide. In the result part, I have tried to compare the Acharya Rasayana concept with its mode of action, which includes the Sattva Jaya, which will help in lowering the cortisol levels, the Krodha Tyaga, which might help in reducing the cytokinase, that it lowers the IL-6 markers that promote the cell growth, and Ahimsa, following Ahimsa, it will improve the increasing the oxytocins, which inhibits the proliferation of certain cancer cells, Japa, meditation, which will increases the telomerase, and Danam, and it will boost the natural killer cell activity. Next slide. So coming to the discussion part, Acharya Rasayana, it not just incorporates the ethical conduct, but it also tells about the internal rejuvenation practices in the form of Nityakshiragrata Abhyasas and the Rasayanas. So depending upon the yukti of the Vaidya and depending upon the condition of the patient, choosing the right Rasayana will help in strengthening the Agni, enhancing the immunity, and it will promote the tissue rejuvenation. So a consistent practice of the Dinacharya along with the Sadvritas, it will help in maintaining an equilibrium between the body and mind. So whenever there is equilibrium between body and mind, this will help in prevention of any sort of the diseases and will help in long-term health. So next slide. I would like to conclude my presentation by telling that whatever our mind tells, so does the body. So by following Acharya Rasayana and the Sadvrita Dinacharya concepts, one can create a safe and calm internal environment, which is very much necessary for prevention of the any diseases, including the chronic cancer. Thank you.
So the time taken is 5 minutes and 6 seconds. We are open for the discussion, sir.
Dr. Shruti, in title you have not highlighted about Sadvrita, but in conclusion you have highlighted about Sadvrita. And I want to know more about how Danam, as you have mentioned, can help in killing natural killer cell you have mentioned. So on what basis you have put that? Is it just an interpretation or you have any evidence for that?
Sir, all these concepts needs more research, that observational studies can be taken up based on this concept. So with this intention, I have taken this topic. There is no as such proof that doing Danam has done the NK cells. It is just a conceptual analysis we have done. So maybe Danam, it might increases the self clarity for the person. Maybe it's concept, just a concept, sir. There's no proof as such. We can take an research over this, sir. It will be more helpful.
But the sentences what you have put are suggesting that it will be. So it is not mentioned as maybe.
Yes, sir. It's a probable mode of action only, sir. It's not a proven one.
Okay, thank you.
I congratulate. It is a better presentation and it is also a need of the hour now, because many YouTubers are making much more things rather than our Ayurvedic scholars. Can you please tell me what is NLP? NLP.
So I should go through it, sir.
Okay. And have you heard Ashwini Devatas?
Yes, sir.
Is there any link between this Shadruta and or Achar Rasayana and Ashwini Devatas? Can you heard some?
Sir, I have heard about Ashwini Devatas, Ashwinau Deva Bishajau, but what is the link between Achar Rasayana?
Okay.
I don't have the idea, sir.
Okay. I'll briefly explain you.
Yes, sir.
NLP is an neuro-linguistic programming, what we can say. So there, this Achara Rasayana exactly comes. Sir has asked about the dana, and people are making money only by explaining the gratitude. Gratitude by dana. They'll take small amount of half an hour, 1 hour class. They'll explain about the gratitudes. I congratulate you. But if you can explore more things regarding the NLP, if we can go ahead with the basis of Ayurveda, it's well and good, and it is the need of the hour. And now we need to talk all these things. The same things the peoples are talking like an neuro-linguistic programming. The same thing they are telling. Right? So yes, please sir. Concentrate that also. Thank you.
Thank you.
Yeah, nice topic, madam. It's
Thank you.
Data Samhasa Satyapara Aptopasevi Bhavatya Roga. It's already proven. It's Bhavati a Roga. Yeah. Thank you.
Thank you, sir. Thank you, sir. Thank you, Dr. Shruti. We have our next presenter, Dr. Brunda AP.
Am I audible?
Yes, ma'am, you're audible. Just a moment. The slide will be presented.
Good evening to the
Yes, you may proceed.
Good evening to the respected judges and my fellow participants. Myself, Dr. Brinda, second year PG scholar from the Department of Kaya Chikitsa, Shri College of Ayurvedic Science and Research. And the title of my topic is Tantra Yukti as a Clinical Research Framework, a Novel Perspective and Diagnosis and Management of Tamaka Shwasa. Next slide, please. So I would like to start my presentation by quoting that Shastra Adigamaha Sugruhitam Shastram Rakshitaha. So the proper understanding of Shastra protects both physician and the patient, and Tantra Yukti is one such concept that we all have to understand to know the essence, the knowledge our Samhita has embedded in it. So Tantra Yukti can be defined as a systematic technique used to interpret Shastra in a meaningful and a clinical relevant way. And here I would like to have my goal to tell you that to explore Tantra Yukti beyond textual interpretation and to establish its clinical and research framework and to demonstrate its application in a common disease like Tamaka Shwasa. Next slide, please. Need of the study. Before I start to the need of the study, I would like to quote a shloka from Charaka Siddhisthana 12th chapter, where Charaka explained, Yata ambuja vanasya arkaha pradipo veshamano yataha prabodakam prakashartam tatasya tantra yuktaha. That means as the lotus blossom, there is a need of sunlight. Also, As the darkened room enlightens with a lamp of light, in the same way, Prabodhana and Prakashartha, that Tantra Yukti helps in knowing the Prabodhana, that is, it teaches our Samhita and enlightens the knowledge that is embedded in our Samhita. So here, I would like to tell you that to reinterpret Tantra Yukti as a clinical reasoning model and a diagnostic framework and a research methodology tool, I had made a little effort regarding it. The next slide, please. Understanding Tantra Yukti through Tamaka Shwasa. So Tamaka Shwasa is Kapha Vata Samudbhutam Shwasam Tamakam Viduhu. So it's a chronic respiratory disorder predominantly caused by visheshan of Kapha and Vata doshas affecting the Pranavaha Srotas. So as the Samprapti goes, Yada Srotamsi Rodhetu Marutaha Kapha Sangataha Pratiloma Yada Vayu Srotamsi Pratipadyate. So to know that the shloka, the complexity of the shloka, to understand the samprapti in a better way and to understand and to interpret, we will have the need of the Tantra Yukti, and if it will lead in a very good proper manner is what I'm going to convey you. So here the importance of Tantra Yukti lies in hidden etological factor, in decoding of hidden etological factors and sequential pathology, and to have appropriate therapeutic interventions. So the next slide, please. Tantra Yukti as a diagnostic framework. Tantra Yukti can be systematically applied to a clinical diagnosis, transforming it into a structured reasoning process. And by using among the 36 Tantra Yuktis, a few Tantra Yuktis where I can interpret are mentioned below. Adhikarana, where here the Roghadikarana. I am focusing on Roghadikarana here, identifying the disease focus. Hetvartha, where the statements can be applied and understood in a different situation. And here we can use it as understanding in the causative factors. Padartha, Padasya, Padayo, Padanama, Padarthaha. That is where there is a simple word Gurguraka. It might be used as a shwasa, but we can interpret its meaning with the help of padartha, and samshaya creating a differential diagnosis, and nirnaya helps in arriving at a final diagnosis. So the sequence can all together be converted into a diagnostic algorithm similar to our diagnostic trees. So the Tantra Yukti enhances us to have accuracy, clarity, and confidence in our diagnosis in a better way. Next slide, please. Understanding Samprapti through the Tantra Yukti is often complex. Samprapti, we all know it would be often complex and layered, and it helps in Tantra Yukti helps in breaking it down into a logical and understandable sequences. And the tools that I have implemented are Hetvartha, and here before it was Hetvartha was used in the context of the causes. Here Hetvartha can be used in connecting the cause and the effect. In Atidesha, predicting. Atidesha is a statement that helps in predicting the future by knowing this current situation. So it helps in predicting the prognosis. And Viparyaya is understanding the opposite physiological states that helps in the chikitsa. Anekata, accepting the multifactorial causation, that is the Agni, Bala, Desha of the person. So the Tantra Yukti allows us to visualize the disease progression, aiding both diagnosis and prognosis. Next slide, please. Tantra Yukti as a treatment plan. Treatment in Ayurveda is not uniform but individualized, and Tantra Yukti provides a framework for this customization. And Upadesha is that has been used as guidelines that is mentioned in the Samhita. So
Your time is up.
In clinical management, and Vikalpana and Apavarga also helps in Tantra Yukti treatment planning. And next slide, please. And this is a case-based application that I have summarized this. Next slide, please. Tantra Yukti as a research methodology, and the Tantra Yukti tools that can be used as a research methodology are the Prayojana, Yoga, Hetvartha, Huya, and Nirnaya. And it helps in designing clinical trials, structure dissertations, and interpret research logically. Next slide. And this, I have used the Tantra Yukti to have a clinical algorithm, research framework, integrative model bridging Ayurveda with the modern science. Next slide. Also, Tantra Yukti helps in enhancing the evidence-based clinical decision-making, enhance research quality, and strengthens the global acceptance of Ayurveda. Next slide, please. So I would like to conclude that Tantra Yukti acts as the oil in the lamp that helps in knowing the essence of the knowledge of Ayurveda, and also it shows that how scientifically based our Ayurvedas have been framed, and it is an answer to a debate that has been currently going on in social media as a pseudoscience and all. But it to be proven, we can take the Tantra Yukti and prove that it is scientifically based, and it is more scientific, and it is Ayurveda is a timeless science. Thank you.
Dr. Brunda, you have taken 2 objectives when the presentation has to be done in only 5 minutes. It was good if you have taken only 1 objective. And I think your protocol, what you have suggested in terms of Tantra Yukti, is helping the framework of Nidana Panchaka, right?
Yes, sir.
So itself, it is not a new framework. So what is the necessity of designing this kind of thing when already we have Nidana Panchaka as a framework?
Sir, the Tantra Yukti, it enhances our understanding, sir, rather of whatever we have, the Nidana Samprapti and all. Tantra Yukti enhances our understanding better. So in that view, I have taken this.
So what I am saying is, still we have to use the Nidana Panchaka only, and we cannot replace. I think you have just replaced the terms based on the understanding.
Yes.
So I don't know how exactly it will be directly useful for like doing the diagnosis. I think Tantra Yukti cannot be directly said as a diagnostic framework, but it will be helping the framework what we have already in Ayurveda for better understanding. I think
Yes,
it will be the more justified statement. I think.
Okay, sir.
Okay. Thank you.
Yeah, no question from me. It's a good correlation. Thank you.
Of course, I go with Sharad sir, but still, if you would have been justified the topic, that is well and good. And what is reverse pharmacology? And that's what the need of the hour for our students now. How this Tantra Yukti may be helpful. Can you please answer? Reverse pharmacology, right? How this Tantra Yukti can be useful? With one example of a drug like Kutaja. In that way, if we have presented, it was better. Many people are thinking of reverse pharmacology now. Huh?
Yes, sir. I'll go through it, sir.
Okay, thank you.
Thank you, sir. The time taken is 6 minutes and 27 seconds. Thank you, Dr. Brunda.
Thank you.
The next presenter is Dr. Ananya Lata Bhatt.
Yes, ma'am.
Can you please switch on the video? You may proceed, ma'am.
Good evening. Myself, Dr. Ananya Bhatt, from Department of Agar Tantra, SDM Hassan. I am here to present on topic of conceptual analysis of chronic kidney disease from Agar Tantra perspective, guided by Dr. Akshitani. So, chronic kidney disease is a progressive and irreversible loss of kidney function lasting more than 3 months. So, in Ayurveda, CKD can be considered as Anukta Vyadhi, involving multiple shrotas like Medavaha, Mutravaha, and Raktavaha shrotas. And some of the conditions that involve in the Samprapti of CKD, like Prameha, Mutrakritsra, Pandu, Udara, Shota, Udavarta, also the involvement of Visha is also taking place. So objectives include to identify the toxic causes of CKD, to understand the role of Dushivisha in chronic renal damage, and to explore the Agar Tantra approach in the management. So due to the rising urbanization, humans are easily get exposed to heavy metals, agrochemicals and pesticides and environmental pollutants, and lifestyle toxins like tobacco, dietary toxins and animal toxins also involves, and chronic irrational usage of the drugs also can causes nephrotoxicity, and exposure may usually occur through inhalation, ingestion or through dermal contact. Next slide. So some of the Visha exposure that can affect the renal pathology, like under Savara Visha we have Datura, Eranda, and Bang and tobacco, and Jangama Visha like Mandali Visha and Mushika Visha also causes renal physiology, and Madhya Visha like chronic usage of alcohol also will causes damage to kidney in the longer run. Next slide. So coming to the concept of dushavisha, as CKD is caused by the chronic low dose exposure to toxins, and it manifests in the later stage, like almost after 3 months, and it can justify the dushavisha concept like virya alpa, abhibhavya laksham, and kalantara prakopi. So hence, when dushavisha lodges in the dhatus, prasadi dhatus, it causes dhatu prabhava vikaras in the later stages. So when in the medadhatu level, through the medava shoto mula, like through vrka, it will manifest sanasamshal may take place in the vrka. Next slide. So here I try to correlate the similar symptoms of dushavisha and CKD like padaka rasa shofa, arochaka, chardi, and pravada prabala trisha. Like in CKD you can see edema, loss of appetite, nausea, and excessive rest. Next slide. So chikitsa, we can rule out the dushavisha involvement and we can go for dushavisha chikitsa like dushavishartham susvinam, urdum adasya shodidam, dushavishari agadam lehain madanapratam. So next slide. So here mainly after Svedana, after removing the kaphavrita, we can go with Shodhana like either Vamana or Virechana, and Dushvishari Agada along with Madhu is been told. And other Agadas like Bilwadi Agada, Pipalyadi Agada, Vishadi Guliga, and Kotam Tagadi Kashaya, Ilakana Churna, these have been already tested, and there are articles on the positive effect on kidneys. And otherwise, through the symptomatic line of treatment, Lakshanasara treatment can be done. Like in Mutaroda, we can give Elakanadi Churna with Narikaradaka Pana, and study has been done in this combination, and there was significant result in the creatinine and uric acid. And other kashayas like Punarnava, Lagu Panchamula kashayas can be given. And in Rakta Mutrata, mainly Mandal Vishara treatment like Nalpamara Kwata, Shatavari Swarasa kashaya can be given. And in Shofa like Seka along with the Saindava and Sarpi is told. And in Trishna, Rambakanda along with the Shira is advised. And in Chardi along with this combination with the Malaja and Narikela Jala can be given for Pana. So as a Shofa Trishna Sardi are also considered as Vishopadrava, it is also mentioned in Vishopadrava Chikitsa and Vishavedya Sara Samuchaya. Next slide. So some of the Visha Dravyas like these are the Stavara Vishas like Bang, Gunja, Eranda, Vasanava, and Kupilo. After proper Shodhana, they can be given in this condition as they have Mutrala and Mutradosha Hara properties. They can be given in Vrika Shota, Bastishula, and in conditions like Atyalpa Mutra Sravana and Sadaha Vedanutam Mutra. Next slide. So for coming to discussion, nephrotoxicity prognosis depends upon the type, amount, duration of the exposure of toxins, and type of toxins and age and health of the individual. So detailed exposure history has to be ruled out in OPD, while including the occupation, whether exposed to like agrochemicals and diet and food source and cosmetics. Like some of the cosmetics are adulterated with heavy metals, and water sources like if they're contaminated with arsenic is important in clinical evaluation. And as this chronic low dose exposure resembles Dushavisha pathology, Dushavisha line of treatment can be given. And as I already mentioned, few Agadas have already proven the nephroprotective action, and those described in other classics has to be explored further. Next slide. So to conclude, CKD can be conceptualized through Visha and Dushavisha perspectives, and as this chronic toxin exposure, though they are not the main cause of kidney damage, but they are act as a silent killer to kidneys. And early identification of toxin exposure is essential in prone individuals like for farmers. They have to rule out early. And Agada Tantra first treatment approach under Dushavisha, Visha Upadrava, and Lakshanasara Chikitsa. Thank you. Next slide. These are the references.
The time taken is 5 minutes and 2 seconds. We are open for discussion, sir.
My side, there is no question, madam. Proceed for next.
Okay, sir. Dr. Srivatsa sir and Dr. Sharad sir.
Two questions here. In generally, you have taken chronic kidney disease. There are many subclassifications of regarding, and even with that may trigger the immune system also. So, in what category of CKD classifications where these Agadas are helpful?
So in mainly in can be given in if there is no multiple samprapti involved. Like in early stages we can give, like in the if it is ruled out in the beginning stages, after ruling out the Dushavisha symptoms.
Okay. Okay.
In case of Dushusha pathology, like if they are prone, if they are exposed to like farming, because there is a condition like CKDU, like unknown etiology. So mainly studies have been done that this unknown etiology mainly comes under chronic exposure to environmental pollutants like these heavy metals, like mainly in arsenic contaminated areas, and with the exposure to fertilizers and pesticides. Studies have been done on particular that on that CKDU.
Is it exactly with an structural changes of nephrons or functional impairment?
Functional was
Studies.
also there. Functional was also there, and in case, even the studies like biopsy was done. They had seen there was changes in the structural also.
Thank you.
Thank you, sir.
No questions from my side. Go ahead.
Okay, sir. Thank you, Dr. Ananya. The next presenter is Dr. Sahana S. Kannal. Doctor, can you please keep your video on?
Yes, ma'am, I'm trying it. Visible, ma'am?
Yes, ma'am, you're visible. You may proceed now.
Namaste. I'm Dr. Sahana Khanna, second year PG scholar from Department of Rachna Sharira, SVM College of Ayurveda, Hubli. Today I am here to present on a topic Ayurvedic perspective of Bija Bhaga Avayava in hereditary disorder, a conceptual analysis with respect to Turner syndrome, under the guidance of Dr. Anju Thomas. Next, ma'am. So these are my contents. Next, please. Introduction. Hereditary disorder arises due to abnormalities in genetic material which affect the growth and development of the body. In modern science, these are explained through chromosomal abnormalities and gene mutation. However, Ayurveda had already described similar hereditary concepts thousands of years ago.
Dr. Sahana, your voice is not audible properly and even the PPT is not visible.
Restart it. Please restart it.
Sir, am I audible now?
Yes,
voice is very low, very low.
Hello?
Yeah, now it is better.
Okay, shall I start now, sir?
Please proceed.
Yes, thank you, sir. So, myself, Dr. Sahana Khanna, second year PG scholar from Department of Rachna Sharira, SVM College of Ayurveda, Udupi. My title is Ayurveda Perspective of Bija Bhaga Avayava in Hereditary Disorder, a conceptual analysis with respect to Turner syndrome, under valuable guidance of Dr. Anju Thomas. So, these are my contents. Introduction. Hereditary disorder arises due to abnormalities in genetic material which affect the growth and development of the body. In modern science, these are explained through chromosomal abnormalities and gene mutation. However, Ayurveda had already described similar hereditary concepts thousands of years ago through Bija Bhaga Avayava. These concepts form the basis for understanding genetic transmission and congenital abnormalities in Ayurveda. Next. Anuvamshiki siddanta. Anuvamshiki siddanta is an Ayurvedic concept of heredity. It explains inheritance based on cause and effect relationship, where the characteristics of offspring depend on the quality of parental reproductive elements. According to Acharya Charaka, vitiation of Bija Bhaga Avayava can lead to hereditary defects, deformity, and congenital anomalies. Next. So, understanding what is Bija Bhaga Avayava, Acharya Sharir in Sharirasthana Chakrapani says Bija iti Shukra Shonita, and also Acharya Charaka Sharirasthana 4th chapter he says Bija iti Kritsanna Eva Arambaki Bija Bhageva iti Avayava Bijasya Ekadesha. Next, please.
So bija refers to the Shukra and Shonita, where gametes in sperm and ovum can be correlated, and then bija bhaga, it is a part of bija that is responsible for formation of anga pratyanga. It can be correlated to the chromosomes. Then bija bhaga avayava, it is a subpart of bija bhaga responsible for formation of avayava of the anga. It can be correlated to the genes. Next, please. Coming to the understanding of what are the causes of congenital anomalies, it says bija atma karma ashaya kala dosha matrustha ahara vihara doshe kurvanti dosha vividani drishtam sa samsthana varna indriya vaikrutani. So understanding bija dosha, here we can take as defect in the shukra and shonita. Atma karma is purva janma papa krita. Then ashaya, it can be vitiation of the garbhashaya. Kala dosha, any timing of the ritu chakra. Then matruja ahara vihara is very important here. Because of this, there will be production of they produce various abnormalities in fetus affecting body structure. That is samsthana varna indriya. Next, congenital anomalies in female. Actually, I am focusing on mainly in three things. One, the puti praja and varta. So when there is a bija bhaga defect in the bija bhaga of shonita, which is responsible for formation of garbhashaya, it is vitiated and leads to vandya. Next, puti praja, if there is a bija bhaga avayava dushti, it leads to the puti praja. We can take it as a dead fetus. And varta, if there is dushti both in bija bhaga avayava and bija bhaga, which is responsible for formation of feminine characteristics, then the child born is varta. In varta, the child resembles like a female, but the feminine characters will be absent. Next, please. As in previous slide, I said that the child resembles like a female, but the feminine characters will be absent. So I thought it can be correlated to the Turner syndrome. So Turner syndrome is a genetic disorder affecting females only, caused by the partial or the complete absence of one X chromosome. Then it is described by the Henry Turner. It is having a characteristic features like short stature, webbed neck, then different facial features, poor breast development, then rudimentary ovaries, gonadal dysgenesis, no menstruation. Next.
The time is up.
Investigation can be done through LH and FSH, USG, and then treatment is no cure is known. Hormonal replacement therapy, estrogen replacement therapy for sexual development. Next, please. Conclusion: Turner syndrome can be concluded as as I said, it can be taken as a varta, as it is having similar clinical features, and integrating Ayurvedic genetic concepts helps in modern understanding, provide a broader perspective into disorder and the management.
So the time taken is 5 minutes and 45 seconds. We are open for discussion, sir.
No question from my side.
Okay, sir. Dr. Aravind, sir.
A nice concept which is explained, madam. Thank you. No questions.
Thank you, sir. Thank you, Dr. Sahana.
Thank you, ma'am.
We have the last presenter for today, Dr. Aditya Arolkar.
Hello, ma'am. Hello?
Yes, doctor, you're audible.
No, audible, ma'am.
Yes, you're audible. Just a moment, the slide will be presented. You may proceed, doctor.
Myself, Dr. Aditya Arolkar, PG Scholar, Department of Chikitsa. I will be presenting on the topic Beyond the Cup, Restoring Dostic Imbalance in Management of Hypertension, a case report. Next slide. These are the contents. So, 54-year male came to OPD with BP of 150/90. Occupation was IT job. Working hours was 9 p.m. to 1 a.m., which is Ratri Jagarana also. So, diet was mixed. Next slide. He came with the complaints like hard stool, pain in abdomen, burning sensation in abdomen. So, which shows vitiation of Apanvata, Samanvata, and Pachak Pitta. Diagnosed as essential hypertension, stage 2, newly diagnosed, plus Amla Pitta. Next slide. So Samprapti was occupational stress and Amla Pitta. Occupational stress, which included both anger and fear, led to Pranavata and Sadak Pitta Visheshan. So Pranavata Visheshan lead to vasoconstriction and increased heart rate, whereas Sadak Pitta Visheshan led to Rakta Dushti and increased cardiac output. Whereas Amla Pitta we took as Nidanarthaka Roga. Apanata Visheshan causes Auran to Vyana, increased peripheral resistance, whereas Samanvata, due to Chalaguna, we consider Vyana Ruddhi, Gunata Ruddhi, causing increased heart rate, whereas Pachak Pitta, Rakta Dushti, causing increased cardiac output, so leading to hypertension. Next slide. So this was the Chikitsa given. Amla Pitta Misran and Oipattika Churna. Previous slide, sorry. Amla Pitta Misrana. 15 ml TID before food. For Pitta Hara and Vata Anuloman purpose, Avipattika Churna 5 gram HS after food. For Anulomana purpose and Cardimap for Medya purpose. Cardimap for stress purpose we give. Next slide. So this was the BP after 8 days. 130/80 stage 1. Next slide. So coming to discussion, 3 paths we can consider: Vata, Pitta and Kapha. Vata we can consider as neurogenic path. Chinta, Bhay and Rakrit Jagran will lead to Visheshan of Pranavata, leading to sympathetic overdrive and Anyannavarana, which causes vasoconstriction and increased cardiac output, whereas metabolic path, Pitta driven, shows Krodha, Lavan, Amla Sevana causes Visheshan of Pitta and Rakta, which causes Rakta Ruddhi, so leading to Raktavrutta Vata, causing volume and inflammatory overload, whereas obstructive path, Guru and Snigdha Sevana will lead to accumulation of Ama and Meda, which is causing to Damani Pratichaya, Kapal Jnanatva Vyadhi, causing Kapavrutta Vyana, leading to increased peripheral resistance. Next slide. So treatment given can be calm, cool and clear. So for Vata-driven pathology, calm the mind, stabilize the nervous system and break the cycle of sympathetic overdrive. For Medya, Dravya and Vata Shamana has to be given. For Pitta-driven pathology, cool, that is cool the blood, reduce the metabolic heat and purge the excess volume and inflammation. Rakta Pitta Shamana and Virechana has to be given. For Kapha-driven pathology, clear, scrap the channels, Lekhana, liquefy the metabolic waste, Ama, and remove the physical obstructions, Lekhana and Shrotoshodhana has to be done. Next slide. So to conclude, stress we can consider both occupational anger and fear. So anger, we considered anger cause Pitta Prakopa, Krodhat Pittam, whereas fear we causes Vata Prakopa, Bhayat Vayu. So Nidanarthaka Roga we considered Amla Pitta. Chikitsa we give is Vatanulomana, Amla Pitta Chikitsa and Medya Chikitsa. Samprapti Vigatana Chikitsa with Nidanarthaka Roga Chikitsa gave the significant improvement in this case. These are the references. Thank you.
The time taken is 4 minutes and 12 seconds. We are open for discussion, sir.
Aditya, can you explain the Medya line of treatment in hypertension? Can you justify?
Sir, Medya treatment, actually, sir, Medya function, what I studied, sir, until now, what I understood is Medya action, Pitta Ruddhi, sir, one is there. Sir, one is Majja Ruddhi, and like that we can give, sir. For Pitta Harja also, it has to be can be given, sir, and Majja Ruddhi also. So both actions can be done, sir, Medya.
Okay, no questions from my side.
You said Majja Buddhi.
Yes, sir.
What is that?
Sir, like Madhur, the way we use, sir, so it will, so Dhatu Ruddhi we can promote that thing, sir. Majjaruddhi, we have to do.
With which drug you are doing this?
Sir, Madhur Rasa we can use, sir. Medhya Rasa, which are there, sir.
So in
Madhur we can
Samprapti, you told all the three. Dhamani Pratichaya, Rakta Vrta Vata
sir,
or Ananya Varana.
Yes, sir. No, sir. For Medhya purpose, we have considered this only, sir. Vata driven plan.
Vata only. It's okay.
Sir.
In your treatment protocol, which was the Medhya drug?
Sir, we gave Cardimap, sir. There is a Jyotismati, then Jatamausi is there, sir. Jatamausi, Sarpagandha is there, sir. Brahmi is there. Shankapushpi also there.
Okay. Sarpagandha action on the cardiac muscles. I think
it is bit doubtful, actually.
And adverse effect of Sarpagandha.
Sir, I will, sir, actually, sir, that is there. Sarpagandha effects are there, sir. Actually, while using Sarpagandha, it has been told Pitta Pradhan should not be there. Ojak Shaya should not be there, sir. So, if we refer Nigantu, in that they are telling like that, sir. So, that condition needs to be avoided, sir.
Okay. In modern, the researches are going on regarding Sarpagandha also. Okay. Thank you. Thank you. Just go through it.
Yes, sir. Thank you, sir.
Dr. Aravind, sir.
Yeah, nice presentation with analyzing. Thank you. No, any question, madam?
Okay, sir. Thank you, sir. Thank you, Dr. Aditya. Now I request our esteemed panelist, Dr. Srivatsa, sir, to address and reflect upon today's presentations.
Thank you, Tadvidya Sambhasha Parishat, for an opportunity. And also personally, I thank Dr. Saurabh Kokotnor for giving this an opportunity. Just I would like to highlight few points regarding this Tadvidya Sambhasha and what is the need of Tadvidya Sambhasha and what the people or this particular situation needs from Ayurveda. Of course, we need to answer many things. We need to stick up to the basics. All the presenters have done well with their cases and the conceptual studies. But the need of the hour is how much we are scientific and how much we are translating our knowledge through in a better way. Because what we noticed is many things, like in whatever the cases were presented, because many Ayurvedic companies having their own actions and their own systematic action. That means usually I am using 4 different Ashwagandha companies. It may be 4 तरह के मैं अश्वगंधा यूज करता हूँ, means different companies, and also Bhumyamalaki I use it from different companies. The spheric of action is usually different there. So one, of course, Neurosil is better in the respiratory conditions, right? So whatever the phylosyl I am using, it is better in the CKD, and I am not getting any results over the respiratory conditions there. So even the youngsters, whoever are coming out, if they can concentrate on all these aspects, right? So stress calm of Dabur has an better results, but it produces myalgia, what I have observed, right? So other from Himalaya has better action on analgesic activity, and from the Pentacare has got better action on the respiratory conditions, right? So in this way, different types of absorption are acting at different spheric levels. And even we should start learning from the basis of Ayurveda, right? What exactly the ashwagandha, where it is there, and what is its action, and what are the formulations which are available in the market, and what is their different actions. Even the Sambhahsa Parishat, if it takes in the next upcoming events, even with an pharmacovigilance, that will be much more beneficial for our students in this way. Even it can be planned also. It was a great effort by Tadvidya Sambhasha Parishat. Really, they are imparting the true basics of Ayurveda. I congratulate whole team. I congratulate all the presenters, and also I thank Dr. Saurabh Kokotnor for giving a better opportunity. Thank you. Thank you.
Thank you so much, sir. I now request our esteemed panelist, Dr. Aravind sir, to address and reflect on today's presentations. Dr. Aravind sir. Sir, am I audible, sir? I now request our esteemed panelist, Dr. Sharad Kumar sir, to kindly address and reflect on today's presentations.
Namaste to all. So before saying my opinion, I would love to thank the whole organizing team, all the teammates who are working for this Tadvidya Sambhasha Parishat, and special thanks to Dr. Saurabh Kokotnur sir for doing this Tadvidya Sambhasha Parishat. Since my PG days, I am actively involved with sir's activities. So I have seen how Tadvidya Sambhasha Parishat has grown from different events to the international platform. So it's really a proud moment that somebody from Karnataka is doing such a wonderful job, reaching different states, and all the students working with sir, and special mention to Dr. Nitin, who is always with sir for organizing this event. Now regarding the presentation, so when the presentation will be for Tadvidya Sambhasha, I expect personally that more of our siddhantas or concepts will be highlighted, and as per that, many of the presenters have presented nicely, and they were able to justify the things. Some students were undergraduate, some are final year PG scholars, and some are second year PG scholars. So in spite of that, they were all good in the presentation skills, and PPTs were good. Some of you are not able to justify some things other than that, but we could not find more novel ideas. So except one or two presentations, most of them are case report. So being a judge, it's quite difficult to judge different genre kind of presentations. For example, case report has a different judgment criteria, and a review kind or something which is conceptual. So, and some topics which are very novel, it's quite difficult, but still we have judged and given our scores. So I congratulate all the all the presenters for the further rounds if available. So once again, I thank all the participants for participating here, and I also thank our judges panel, Dr. Srivatsa Navalur sir and Dr. G. Kannoli sir. We could know some more new points from Srivatsa sir with his experience. With these words, I conclude my words. Thank you, Anand.
Thank you, sir. Dr. Aravind, sir.
Yes,
Sir, I
yes,
kindly
madam.
request you to reflect on today's presentations and guide the participants.
Yeah. Namaste to all. Everybody has in a presentations is very integrated and knowledgeable one. Few of the topics are very interesting, and even I can't express those things, even the imagination. They are the beyond of that one. Their thought is very good one. And more than that one, everybody has a good preparations for their presentations. Even not a single questions, they are not asked any answers. They are trying to make an answering. Even they have made the justification for that question. And even I learned a few more things about the present students, how they are thinking it. That's a good idea in their presentations. And more than that, thank I to the Tadvidya Sambhasha and Dr. Saurabh Kokatnoor sir, and my co-judges, Dr. Srivatsa sir and Dr. Sharad Kumar sir, as this is a wonderful opportunity for me. Thank you.
Thank you, sir. Now I welcome Dr. Saurabh Kokatnoor sir to kindly address on today's presentations.
Namaste, everyone. At the outset, I would like to extend my gratitude to my teacher and always supporter of my activities, Dr. Srivatsa sir. Being with his very busy schedule, many know that how his OPD is. In spite of that, he could spend more than 2.5 hours with us in judging more than 16 scientific papers and giving insight in between with his experience, even to the depth that how the pharma industry is preparing and where we need to address. That was a great mentioning by Honorable Judge. And Dr. G. Kannoli, who is one of the bridgestone while building the Tadvidya Sambhasha Parishat. If I am not wrong, when he was in final year PG, the Tadvidya Sambhasha Parishat child took birth as a study circle, and now it is into the International Academy. So Aravind,
Yes, true, sir.
yeah, Aravind, I'm very, very grateful for you being same attitude since his student life continued with his all responsibilities in a biggest institution of one of the biggest institution in northern Karnataka. And you all know Dr. Sharad, that where he stands with his activities in all social medias, since as he mentioned that he was PG scholar when he attended the first conference, and since then I have missed many of his events in spite of having invitation, but he never missed any of my conferences. That's what his politeness and humbleness is depicted in front of all. Thank you, Dr. Sharad, for being actively involved in spite of your quite busy schedule in relation with APTA's activities. I thank you for being over here. All three panelists are very known to me, and one is expert in clinics, the other one expert in Samhitas, the other one is expert in present technology and its utility. So this is how the panel was selected. And I heard judges were asking to send the presentations or the student's name with their titles prior in the group, but it was not possible, and never we give, because we are giving it to the software the whole presentations, and it gives us the randomized numbers on that particular day, and we listed it out, and it was kept only with me and the other scientific person. I don't want to take his name because there is tomorrow the presentation also, just to keep authenticity and transparency among presenters and judges. There might be any attraction or some sympathy, empathy may generate between the judge and presenter. With that motto, we never shared any delegates or presenters' name or the scientific validation to anyone so far. And the other thing is, Dr. Sharad mentioned about Tadvidya Sambhasha means it is having more of Samhita based activities. That is very, very true. Hence, we made two categories. One was Shastriya Samvada, other one was Vaidyanika Samvada. Now we are running with Vaidyanika Samvada, where scientific presentations as how the present era is moving with. And you all will be witnessing Shastriya Samvada this year too. And if memory goes fine, last year Dr. Srivatsa sir, who is present principal of JMC Mysore, could engage Pariksha till midnight 1:45 AM with a temperature in the venue was 13 degrees Celsius. And students, participants were so enthusiastic to present Shastriya Samvada because there is no time limit. It is all dependent on the judging panel that where they want to end the presentation. Until then the student will continue. So that you will also be witnessing in the upcoming days, which will be completely Shastriya Samvada. And you'll also be sent an invite letter to join in for the online mode of presentation for the first round for Shastriya Samvada too. So with this basic information message to all of you, I thank all the three panelists for today's presentation who have spent their valuable time with all of us. And thank you all the presenters for your worthful activity in preparing the slides as per the rules and recommendations. Thank you organizing team for running this event very smoothly, and the media team who is continuously struggling behind to stream it live over the YouTube channel. Thank you all viewers and members of Tadvidya Sambhasha Parishat. Thank you one and all. Thank you.
Thank you, sir. This brings us to the end of the day 2 of the scientific paper presentations. On behalf of the Tadvidya Sambhasha Parishat, I would like to extend my sincere gratitude to our today's esteemed panelists, Dr. Srivatsa Navalur sir, Dr. Aravind sir, and Dr. Sharad Kumar Prajapati sir for their valuable presence and guidance. I also would like to thank Dr. Saurabh Kokatnu sir, Managing Trustee of Tadvidya Sambhasha Parishat, for organizing these conferences and providing a stage to all the Ayurveda enthusiasts. While today's session was virtual, the true presence of Parishat lies in our shared presence. We are eagerly awaiting your physical presence at the main conference to continue these discussions in person. Thank you. Have a productive day ahead. Loka samasta sukhino bhavantu. Thank you.
Thank you. Thank you very much.
Thank you, madam.